Maybe today, within half an hour, it will be uploaded on the channel, so you guys can access. Okay, doctor.
Dr. Imran, just give me a sec.
Sure, doctor.
Okay. So, Dr. Sama, your patient is Mr. Ahmad, 45 years old male, came to discuss his problem with you. Please proceed with history, examination, and management plan.
Okay.
Okay, doctor, start.
Hello, Mr. Ahmed. I'm Dr. Saima. How can I help you today?
Yes, doctor. Actually, I twisted my knee while playing the football yesterday, and now I feel it's swelled up a little bit.
Mm-hmm. And can you tell me more about it?
Yes, actually, when I was playing, then I got a hit, and I felt a pop sound on it, and now it feels wobbly.
Mm-hmm. Okay. So before proceeding into the case, so can I ask you a few questions?
Sure, doctor.
Okay. So can you tell me when did it happen?
It happened yesterday.
Okay. And is it the right or the left one?
The right knee.
All right. Okay. Is there any swelling?
Yes, doctor.
Mm-hmm. Any pain?
Yes, doctor, a little bit.
Okay, so what about with the movement? Are you feeling any pain with it?
Yes, doctor, and I feel like giving away of my knee.
Mm-hmm. So, what is the intensity of the pain? If I give you the scoring from 1 to 10?
Yesterday when I got the hit, it was 7 to 8, but now it's like 5 or 6.
Mm-hmm. Okay, any fever with it?
No, doctor.
Mm-hmm. Okay. Do you have any chronic medical, sorry, do you have any medical condition like high blood sugar?
No, doctor.
Okay, any high blood pressure?
No, doctor.
Mm-hmm. Okay, so what is the character of this pain?
Doctor, it feels like sharp pain, or sometimes when I'm walking or putting pressure on it, then it feels
Mm-hmm. Okay, and where this pain is exactly located?
on the medial side.
On the middle side. Okay. Okay. And any factors which make it worse?
Only the walking.
Okay, and any factor which relieve this pain?
Resting.
Interesting. Okay. Okay. So, any such condition happened before? Like,
No, doctor. Only this time I got injury here. Earlier I had ankle injury 3 years ago.
okay. Okay. So are you taking any medication for this pain now?
I took paracetamol.
So is it relieving the pain?
A little bit, not a lot, doctor, but I'm worried like it could be some fracture, maybe.
Mm-hmm. Okay, we will talk about it. Okay. And okay. So any drug allergy you have?
No, doctor.
Okay. So Mr. Ahmed, what you are doing for your living?
Um, doctor, I'm a footballer.
Okay. And are you smoking?
No, doctor.
Okay. Any alcohol consumption?
No, doctor.
Any recreational drugs you are using?
No, doctor.
Okay. With whom you are living, Mr. Ahmed?
I'm living with my wife and one kid.
And how are the conditions at home?
Everything is fine.
Mhm. And beside this football, what you are doing for your, living?
Um, just part
And
time, I do some online job also, like this IT worker. But recently, I'm going into the tournaments upcoming.
Okay, okay. So, what are you thinking that what you have now, Mr. Ahmed?
Doctor, maybe I got a ligament pull, or maybe it's a fracture. I don't know.
And what's crossing your mind?
Yeah, this is a ligament pull, maybe. I
Mm-hmm.
have concern that will I need any surgery or will it affect my sport?
Okay, we will talk about it. And what's your expectation from the today's consultation?
Any medication or treatment plan can you suggest me, and any scan if I need?
Mm-hmm. Okay. So, how this condition is impacting your life?
Doctor, actually, it is impacting my work. I wasn't able to go in today's training.
Mhm. Okay. So, Mr. Ahmed, you told me that you have a knee twist, the right one, and yesterday, and now you want something to fix this problem, either surgery or medication. Is that all, or you want to add something else?
No, doctor, only this.
Mhm. Okay. So, Mr. Ahmed, I want to do some examination. Is that okay with you?
Sure, doctor.
Okay, first of all, I will I'll do my, I will sanitize my hand with the alcohol, and under the chiffon, I will do the general physical examination, start with the palms of the hand and nails, and then I will check the pulse and blood pressure with the lymph nodes, and then I will ask you to, can you please raise your pant above so that I can see of, if you need help, I will help
Okay,
you. Okay.
okay, doctor.
So I will uncover your both this legs above the knee level, and I will do general inspection first for any swelling, for any deformity. Then I will do the palpation first on the left one, and then from then of the right one, and we'll see the any tenderness, any for the any swelling, any warmth, and then I will ask you to move a little bit. So examination finding.
Okay, so patient's swelling is positive, joint line tenderness, medial side tenderness present, reduce active and passive flexion.
Mhm.
And did you do any tests? Oh,
No, I didn't. I did.
okay, okay.
So
So neurovascular is intact, otherwise normal.
Okay. Mr. Ahmed, I will do some X-ray for you, and I will refer you for the X-ray, and will refer you to the specialist. Meanwhile, I will give you some. I will ask you to do some rest and limit the movements this at the knee level. And beside this, I will give you some painkillers like Panadol. If it's not working, I will give you the Brufen. Do you have any stomach problem?
No, doctor.
Mm-hmm. Okay, Mr. Ahmed, I will refer you to the hospital. They will do the X-ray and they will then manage you accordingly. And after that, you can come to me. Is that okay?
So, doctor, where should I go now?
I will send you to the hospital. They will do the X-ray and to the specialist.
Okay. Okay, doctor.
Okay. Okay, thank you.
Doctor, still you have 55 seconds. You want to say anything else?
Doctor, I'm confused in this what
No
to
worry, doctor.
add more. Beside this, I will just no, I think it's done, I think. Um, yeah, I think injury बस इतना ही है डॉक्टर.
Okay.
Hello.
Okay, Dr. Imran. Up to you.
Yes, doctor. Thank you. So, Dr. Saima, you took 5 minutes and 56 minute, 5 minute and 56 seconds actually to complete your history, which is a little bit longer than usual. Okay, you have to bring it in under 5 minutes. When you started opening statement was good. Then after that you capture the history, past history, patient's red flags, differential diagnosis, drug history. Did you ask about family history?
No, because I thought that maybe this injury is not related, so
Okay,
that's
and
why.
did you ask the patient the pain? Are you in the pain right now?
No. I
Okay,
just
that's
asked that is there any pain associated, but not now.
okay. It means like say we have to understand the seriousness of this issue. Okay. For example,
Mm-hmm.
this patient came with a knee pain, so might be he is difficult to walk. So we have to ask him how do you came. Okay. What was the
Mm-hmm.
support? Okay. Second thing, you have to know about uh, you know patient's pain. If like the patient in the pain, we have to ask about, we have to give him some pain reliever in beginning.
Mm-hmm.
Okay.
Yes.
Third thing, when your psychosocial was good, high impact was good, you captured. And did you summarize?
Yes.
Okay. Um, Whenever we do the examination of the knee or anything, if like say if I miss anything, the examiner will tell you that my findings are normal. For example, you forget to do some special test like say Leishman test, posterior draw or anterior drawer test kind of thing. Okay, then
Mm-hmm.
you wanted to see the collaterals and menisci, like McMurray test or these things. You have to say that I'm going to do this test and this test. Okay, so in the
Okay.
exam, literally they are expecting you to do this anterior drawer and posterior drawer test and McMurray test because this is the most important part over there.
But
Okay,
doctor,
because performing this knee trauma case in the orientation program they given us and they strictly they told us if like say you are not doing any special test, okay, it will be considered incomplete and we will not give you the findings. Okay, so
okay.
yeah, you have to say that I'm going to check your knee joint and you have to tell I will be checking first your normal then followed by the pain one. Okay, if
Yes.
at any point if you feel discomfort or pain, please let us know. Where patients say pain, don't continue the
Mm-hmm.
examination, stop it.
Okay.
Either it is an appendicitis, in cholecystitis, any kind of examination. If patient say I am in the pain, SP says the pain, so you should say that okay, I'm stopping here. So examiner will give you reading. The reason, because here examiner want to know that how much you are patient centered rather than you wanted to
Mm-hmm.
complete whole task.
Okay.
Okay, then at the end of the examination, you have to say that I will be doing Ottawa rules. You know what are the Ottawa rules are there? Okay,
No,
okay.
maybe I
Ottawa
forgot.
rule for the knee is different. For every joint is different. Okay, so to decide whether patient need an X-ray in this acute injury or not. For example,
Exactly.
if patient age is more than 55, okay, patient having isolated patellar tenderness in the knee and fibular head tenderness, okay, on the examination, inability to flex the knee to go to 90 degrees, sorry,
Mm-hmm.
okay, and inability to weight bear for 4 steps. Hey, in history you have to ask how you came. Are you able to walk? Are you able to bear your weight for at least, he will say, doctor, I can walk up till 10 to 15 steps. Okay, but he said, doctor, it's very difficult to walk. I can't step up till 2 steps because I can't hold. It means that this patient is a need immediate assessment and immediate referral.
Mm-hmm.
Okay, so if Ottawa rule is positive, then we are going to arrange the X-ray. We will be saying that I am going to send you to the emergency department or in acute setting like say orthopedic trauma center, whatever so on. Huh?
Yes.
So there will be something a little bit more common pattern likely diagnosis we have to know in the knee injury. There are doctor almost 6 type of cases might present. Let me take
Because
advantage
it's
of this for this knee, okay? For example, if patient come with ACL tear, so typical history will be twisting injury. He will say audible pop and immediate swelling and instability. This is ACL tear, okay? But for example, doctor, if it is a meniscal tear, it will be twisting with a planted foot. Okay. Delayed swelling will be there. Patient, doctor, it happened 2 days, 48 hours ago or 36 hours ago. My coach given some painkiller medicine. I went home back. Morning, I have saw that my knee swollen.
mm-hmm.
Okay. And patient will be saying, I am having locking and catching. Okay. And his joint line will be tenderness on the examination. Pointing. Okay. This is a meniscal tear. But doctor, if what about MCL and LCL or sprain or tear? Patient will be say, doctor, I have direct blow in XP. He will be telling you direct blow or valgus or varus stress. Patient will be showing the localized pain at the medial or lateral joint line. This will be considered as a sprain or tear of MCL or LCL, medial collateral or lateral collateral. Okay. Now, doctor, what about patellar fracture or patellar tendon injury? So patient will be he'll be saying, doctor, I fall down on the patella. Like say, how we going to in a Muslim going for ruku. He fell down like this. So he got the injury. We have to know how you fell down. Doctor, I was running and I fell down on my face side, but my knees hit on the ground. Okay. So we have to know type of the injury and type of fall, how he fall down. Okay. And it will be isolated. Patellar tenderness will be there and patient will be feeling difficulty in extending. Okay. This one we call it patellar fracture or patellar tendon injury. Okay. Then doctor, there might be one patient, uh, like say elderly patient.
Osteoarthritis.
He's Yes, osteoarthritis, but there is a typical history will be there, doctor. Just we are not. That's the reason in OSCE. This is a beauty of OSCE that we are seeing that this is a clear cut is osteoarthritis, but having some problem, other problem. He will be saying, doctor,
Baker
I
cyst, maybe.
I got hit, minor trauma. Okay, or patient might come with flare or pain of the pain or the swelling. Doctor, I'm already having this knee joint pain, but suddenly I found out that my knee is getting swelling, doctor. And crepitus, we call it osteoarthritis flare or degenerative meniscal tear. So these are the 6 scenarios you will get in your knee joint, knee related cases. Okay, so
Mm-hmm.
please be focused on the history, nature of injury, okay, when it happened, okay. So it will tell you the whole story. Okay, meniscal tear will not be immediate swelling. ACL tear will be immediate swelling. So here we are going to differentiate and diagnose on the basis of history also.
Mhm.
Okay, yes. And on the examination basis, doctor, when you see that, you will be able to see MCL or LCL, sprain or tear. That's why examination is important. And nature, how patient fell down. So if patient say, I fall
Mhm.
on my knees, it is a patellar injury.
No.
Okay, if there is a no red flags are there, so that we are going to assume that is a fracture. No, if like say that no fracture or major ligament rupture, then we are going to deal the patient with relative rest and activity modification. And we are going to say that, Mr. Khan, you have to apply ice or compression and elevation for the short term. And if patient don't have any contraindication, we are going to offer him simple analgesia, paracetamol, NSAIDs if appropriate. Now, doctor, question arise. Mostly it is says that patient having knee pain, we have to offer paracetamol.
Mhm.
But BNF and other guidelines says that if there is an injury, paracetamol is not going to affect because this is acute inflammation. So you can
Inflammation.
offer NSAIDs if there is no contraindication.
Hmm.
Okay, and we have to say some crutches if needed for the short term we can go, and we can say that safety netting if in case Mr. Khan is your knee joint is getting swelling, if you're getting the fever, if you are having inability to now you can walk around, but in case if you feel that you are unable to bear your weight, please directly go to emergency. And we are going to refer for non-urgent physiotherapy. Why I'm saying
Mhm.
non-urgent physiotherapy? Because in acute cases, if you say I'm going to send you to physiotherapy, this is a pitfall. You just overlook patient's condition. Though you say that you are going to say for the physiotherapy, but you have to say that non-urgent physiotherapy.
Okay.
Okay?
Okay.
Let the inflammation or swelling reduce, and after that I'm going to refer the patient. Okay, then we call it consider routine or orthopedic referral. If, for example, patient having locking and giving away. Doctors, I can't hold on. Doctor, my knee is locking. Yes, you're going to refer the patient, non-routine referral. Suspected significant ligament or meniscal tear while football player or some fell down during the rain or anything, or ongoing pain or functional limitation despite good physio and time. Doctor, I went for the physiotherapy, but my knee is not working anymore. So I have to refer. So this was a doctor knee joint a little bit because it was actually quite interesting topic. I took little bit longer to address. Doctor, please, you want to ask any question?
No.
Okay, doctor.
No.
So next question, next scenario.
Okay. Dr. Iman, just give me a second.
Sure,
Dr.
doctor.
Iman, sorry, I'm
Yes,
asking one
doctor.
question. So this
Yes,
patient
doctor.
has to be referred to emergency or what in this case?
Let me tell you, doctor. This patient examination finding was. Give me 1 minute, doctor. I have to go back to his finding. Okay, doctor. His Leishman test was positive. Anterior drawer test was positive. He had ACL tear.
Mhm.
Okay, swelling was there, and effusion, bruising, deformity was there. Okay, and a mild joint tenderness was there. So this need to refer.
Immediately to the emergency?
Yes, immediately to emergency doctor to protect the limb.
Mm. And
But for
X-ray is
example,
needed also, yeah?
yes, doctor.
Okay. Okay.
Not MCL, sorry, doctor. This is ACL. Sorry, MCL. Posterior draw test was positive, doctor, because it happened yesterday. It's a delayed, no? So you see the duration, nature of injury, and um, patient, what you call it, a patient examination matters. And doctor, in past medical history, you have to ask about bleeding disorders and anticoagulants
Mhm.
in the knee injury specifically or some hip injury.
Excuse me, why we ask the history? Can you please explain why we ask the clotting and this history, bleeding history?
Yeah, for example, doctor, in this case, for example, this patient happened yesterday, he immediately got swelling. So we might say that some sort of minor bleed is there, which is not stopping. Okay, patient having some clotting issues are there. Patients taking some anticoagulants in the elderly patients. Okay, so it means like say we have to understand that nature of urgency, how urgently I can send the patient to the hospital for further management.
Okay.
Okay. So next scenario, Dr. Saima, are you there?
Yes.
Okay. So your patient is Miss Sara Khan, 31 years age, came to discuss her problem with you. Please proceed with history and management plan. Examination is gray. Like examination, if you want to do, then there could be some findings, but sometimes if you skip it, uh, but it's up to the candidate if you want to do. Okay.
Case
So
number,
Okay.
let's
doctor.
start.
Doctor,
Yes,
case number.
doctor, it's second case number from the
Okay,
last recent list. Dr. Imran, from the
okay.
recent list. Okay.
Sure, sure. I'll be taking care of that one.
Okay, can I start?
Doctor, give me 1 minute, doctor. Second one.
Patient name is Miss Sara Khan, 31 years old.
Okay,
Okay.
doctor, start.
Okay. Hello, Miss Sarah. I am Dr. Saima. How can I help you today?
Doctor, I have this bleeding and I'm getting pain also.
Can you tell me more about it?
Actually, doctor, it's been like I'm feeling some spotting and then I started having pain down below. And my periods are late, so I don't know what's happening to me.
Mm-hmm. Okay, so is it possible that I can ask you a few questions?
Sure, doctor.
Okay, so Miss Sarah, when this bleeding started?
It started just yesterday.
Okay, and what about your it started yesterday? Okay, so before that, are your periods are regular?
It used to get on irregular, but recently it was regular, but now it's 7 weeks ago since I got my last periods.
Okay, 7 weeks before, like you mean?
Yes,
Okay, and what was the length of your this periods, the cycle?
it's 30-day cycle.
Mm-hmm. Okay, and what about the pain?
Doctor, I started feeling pain 2 days ago, and it's a dull kind of pain.
Mm-hmm. Okay, and when your periods when was the age when your period started?
13.
13. Okay, okay. So any beside this bleeding and pain, any tenderness in the breast?
No, doctor.
Okay, any mood changes?
No, doctor.
Mm-hmm. Okay, so Miss Sarah, any bleeding disorders you have?
No, doctor.
Okay, any high blood sugar?
No, doctor.
Any high blood pressure?
No, doctor.
Mm-hmm. Any Okay, so are you married, Miss Sarah?
Yes, doctor.
Okay, so how many years ago?
It's been 2 years. We're trying for a baby.
Mm-hmm. You are trying for a baby, so you don't have any baby now?
No, doctor.
Okay. So any miscarriages you have before?
No, doctor.
Mhm. Okay. Okay. Are you smoking, Miss Sarah?
No, doctor.
Okay. Any alcohol consumption?
No, doctor.
Okay. Any recreational drugs you are using?
No, doctor.
What about your weight, Miss Sarah?
It's 28.
Okay. It's 28 BMI. Am I right?
Yes, yes.
Okay. And do you have any some thyroid problem? Any swelling in the neck?
No, doctor.
Okay. So what you are doing for the living, Miss Sarah?
I live with my husband. I'm a housewife, doctor.
Okay. And how are the conditions at home?
Everything is fine.
Mm-hmm. Okay. Miss Sarah, sorry, I forget something. That between the periods, do you feel any spotting?
No, doctor.
Any other discharge down?
No, doctor. No, doctor.
Okay. Any fever you have?
No, doctor.
Mm-hmm. Okay. Okay. So, Miss Sarah, what's coming? Any family history of the same condition?
No, doctor. It's just a spotting. I don't know what could it be.
Mm-hmm. Okay. And any birth controls you have used before?
No, doctor. No.
Oh. So, Miss Sarah, what's okay? So, what's coming to your mind, Miss Sarah?
Doctor, I don't know. Is it just related to something? Because my pregnancy, I don't know if it's 7 weeks over. Maybe I am pregnant, but I'm not sure
Mm-hmm.
about the bleeding.
Okay. Okay. And what's coming to your mind?
I'm scared that it might be something bad if I'm ignoring it, and maybe it's something else that I could die.
Mm-hmm. I hope so. It's not. Okay. And what's your expectations from me?
Can you do a scan for me?
Okay, we will go. Okay. Miss Sarah, I want to do some general physical examination. Is that okay with you?
Sure, doctor.
Okay, so I will check your palms and the nails, check for the paleness, we'll check the pulse and the blood pressure, and we'll see your eyes, conjunctiva, I can see the conjunctiva, and then I will ask you for the abdominal examination. Can you please raise the shirt under the cover of chevron? I will start general physics. Sorry, I will do the examination of abdomen. Is there any tenderness now?
Soft, mild right iliac fossa tenderness, no guarding or rebound, no palpable mass. Anything
Okay.
else? The BP is 118/72, heart rate 86.
Mhm. Okay. So, Miss Sarah, I want to do some test. Is that okay with you?
Sure, doctor.
Okay, I will I will refer you to the specialist, and meanwhile, I will do the tests like CBC, ferritin, LFTs, PT, and APTG, and along with ultrasound. Is that sound okay?
Sure, doctor.
Okay, so Miss Sarah, meanwhile, you will do rest and
Did you do UPT, Dr. Simon?
sorry.
Did you do pregnancy test?
Oh, sorry. Yes, I forget. Okay,
Yes, it's
I will.
positive.
Okay. So, okay. So, sorry, Miss Sarah, I forget. What is the amount of bleeding? Is that little or? Too much.
It's very little, doctor. It's spotting.
And what about the pain intensity?
It's 5.
Okay. So, Miss Sarah, it could be normal because it's the spotting, but still, I will refer you to the specialist for the ultrasound and for the other test as well, just to ensure that there is no miscarriage. Is that sound okay?
Doctor, don't tell me miscarriage. I
No, no,
already
no.
wanted this pregnancy.
I hope so. It will be not, but just to, to be on safe side, I will just refer you just for the specialist, consultation. Is that okay?
Okay, doctor, what will happen to me there?
They will do few tests and they will assess you and then they will discuss accordingly. Then after that, you will come to me and we will discuss some more points about your condition. Is that okay?
Will they do some scans?
Yes, they will do ultrasound as well to
Which
confirm.
ultrasound, doctor?
They will check the abdominal ultrasound, and if necessary, they will do the transvaginal as well.
Okay.
Okay, and then you will come to me after that. And meanwhile, in between, if the bleeding get worse more, or you feel fever or something more pain, then you can come to me. Well, we will go to emergency immediately.
Okay, doctor.
Thank
So
you.
I should go
Yes, I will refer you
to
now.
the specialist right now.
Yes, I will refer you to the specialist.
Okay.
Is there someone is someone is with you?
Okay, time up.
Yes, my husband.
So, Dr. Saima, what was the diagnosis?
It's maybe threatened abortion, something abortion, but
Okay,
I'm confused.
okay. No problem, doctor. It's okay. Let me tell you, doctor, a few things. Whenever we are seeing this kind of patient, any woman in a reproductive age with a positive pregnancy test plus lower abdominal pain or vaginal bleeding, always assume ectopic until proven otherwise. Let
Mhm.
me tell you why. Because this kind of patients need immediate emergency referral via ambulance, not by their own convenience. Because they are more tend to get collapse, syncope, marked dizziness, hypotension, tachycardia, and signs of shock immediately. These patients have from zero pain to pain score 10. Within seconds, they will go with severe abdominal pain, gardening, and rebound tenderness. These patients always ask, say, do you, this your, in the OSCE history, doctor? This kind of patient, they will say, doctor, if you ask, okay, is this pain is migrating anywhere else from lower abdomen to shoulder tip pain or chest pain? It means
Mhm.
in this kind of patient, if like say they are taking the scenario as intra-abdominal bleed, so they will be talking about this is a severe emergency, okay? And heavy vaginal bleeding with systemic symptoms like say tachycardia, low blood pressure, and this kind of tactics patient will come, okay? But family history, sorry, so now how we are going to talk about this kind of gynec history, sorry, this patient history. At first point, you have to ask about LMP. Don't relay the LMP till psychosocial or after past medical history.
Mm.
Okay, whether you're planning for pregnancy or not, and method of contraception, if any. Then followed by the you can Socrates, Socrates, then LMP, whatever so on, then bleeding amount, clot tissue, whatever so. Then touch to the red flags like the dizziness, shoulder tip pain, urinary or bowel symptoms. Now, risk
Mhm.
factors are there. If, like, say, this patient is saying that I had a previous my ectopic pregnancy, so with it means patient is having this is a precious one because one tube already. If, like, say, tubal pregnancy was there, so one tube they remove already, so one fallopian tube is remaining now. So this is a precious pregnancy. Is there any other infection, doctor? I am known case of PID. or there is some sort of tubal surgery done, or maybe patient gone through IVF or IUD, or maybe risk factor is smoking. Huh? So this is a primary care setup assessment we call it. Okay, in examination, if like say you do the examination, but most likely in OSCE examination is not required. But if it is, they sometimes they put the scenario that examination is gray, like say nothing mentioned about examination, then you go to see general physical examination and just palpate the abdomen only. And you can say that I'll be checking your private part. But here in ectopic pregnancy or other pregnancies, most of the time we have to follow the local guidelines again. Okay, here you should not say that I will be using speculum or bimanual usually because it is not essential because we are going to refer this patient urgently. This patient management is always I will be setting the IV line to you A, B, C, D, E. I'm going to call the ambulance and referring to the emergency department. Is there anyone else is here for you? Yes, her husband was here. Okay,
Mm.
Mrs. Khan, I am just suspecting that you are having condition, we call it ectopic pregnancy. Do you have any idea about that one? If she is having previous, then she will say yes. If she don't have previous one, she will say no. Then you have to explain that from the test and from your history, it says that you are pregnant. To confirm further, I need to send you emergency to the hospital because time matters over here. Okay, and to know about, they will do few tests and some scan. Now what scan, doctor? Here abdominal scan is not going to detect anything at all, so you have to say that we will be doing transvaginal ultrasound. We will put that probe down below, from the down below. Okay,
Mm.
and you have to start and put nail by mouth that patient immediately. This is the one here to understand patient's condition. Okay, if patient is
Okay.
unstable, if patient is stable, for example this patient was stable, so then you're going to send same patient same day referral for the early pregnancy unit or emergency department according to the local pathway. As for Pakistan, India, Bangladesh, Sri Lanka, you have to refer to the emergency department because we don't have any early pregnancy units in Pakistan in these areas. So, and we have to clear that you have to say that I'm going to clearly document this thing. Okay. And our advice not to take anything, advice nil by mouth.
Mm.
Okay. Now, two scenarios, doctor. Patient having red flags, then you have to follow the A, B, C, D, E. Okay, calling the ambulance. Second,
Mhm.
if stable patient is there, you can refer the patient to the emergency department. If one red flag is there, in anyhow you are going to send with the ambulance and safety netting. Okay, simple
Mhm.
example, doctor. Explanation. You can say that I am concerned that you might have a pregnancy that is developing outside the womb. We call it ectopic pregnancy. Okay, Mrs. Khan, this
Mhm.
can sometimes cause internal bleeding, which can be serious. I can understand your concern that no one is there to take care of you, but here I will be sending my staff nurse with you. So we need you to be assessed urgently in the hospital today itself. Is that okay for you? Okay.
Mhm.
If she is resisting, doctor, no, it is not. Okay, Mrs. Khan, I can understand your life. I can understand your concern that you have to go to the job or you have some sort of important task like say interview, but your life is more important. Are you understanding me what I'm saying, Mr. Khan? And you have to acknowledge the pregnancy loss and emotions and avoid jargons. Okay, patient will be worried about patient having precious pregnancy, patient had previous miscarriages or gone through IVF or some other thing. Now she become pregnant. So we have to understand seriousness.
Mhm.
Okay, so
Okay.
this was that from my side. Doctor, you want to add anything?
I have a question, Dr. Imran.
Yeah, doctor.
Dr. Imran, I have a question that in this scenario, the patient was 7 weeks amenorrheic, right?
Mhm.
So threatened abortion, the patient will come after like this week, like 10th week, 14th week. What will be the amenorrhea she will present in threatened?
I'll
Threatened
tell
doctor.
about it.
Yeah, doctor.
Can I tell Dr. Imran?
Yeah, please,
Yeah,
doctor.
firstly, there were few points that were missed in the history. Firstly, what kind of spotting she has. She
Hmm.
had a brownish spotting, okay, no fresh bleeding. Firstly, in threatened miscarriage or any kind of miscarriage, will be fresh bleeding,
Hmm.
okay. It could be under 10 weeks, but still the bleeding pattern should be different, and the severity of the pain in threatened or missed, you won't feel any pain. Here in ectopic, you will feel dysmenorrhea or cramping pain or sharp pain when on the movement. Okay. Secondly, the radiation of the pain. Third, there should be any previous risk factors. Like in this case, she was treated for STIs, like we discussed before in the sessions. Like ectopic must have a risk factor. Okay, so as Dr. Man said, any painful bleeding or spotting under 10 weeks or even after 7 weeks, you can say it's ectopic until proven otherwise. So she was treated for chlamydia 3 years ago. So this
Yeah.
was the factors in this patient. So if she doesn't have any discharge from down below right now, but she could have previous treatments for any infection. So we need to ask. Yeah.
Okay, doctor. So what's next?
Okay. Third scenario.
Okay. Okay, again, Dr. Saima.
Dr. Simon, Mr. David, 59 years old male, came to discuss his problem with you. Please proceed with history, examination, and management plan.
Mr. David, how old?
59. 59.
Okay. Hello, Mr. David. I'm Dr. Sama. How can I help you today?
Doctor, actually, I've got this annoying cough and it's not going away.
Mm-hmm. Can you tell me more about it?
Almost since 4 to 5 weeks, and I'm having this dry cough, and it's mostly at ticklish at night also. But I'm not getting any flu or any fever with it, doctor.
Mm-hmm. So can I ask you a few questions, Mr. David? Is that okay?
Sure, doctor.
So, Mr. David, you told me that you have a dry cough from 5 weeks. Am I right?
Yes. Yes, doctor.
Okay. And before that 5 weeks, were you okay?
Yes, doctor, I was
You were
perfectly
fine.
fine. Yes.
Okay. Okay. Any condition before? Any cough?
No, doctor, never.
Mm-hmm. Okay. And is this cough is more in the morning or in the evening?
Mostly in the evening.
In the evening. Okay. So, any history of fever?
No, doctor.
Mm-hmm. Any chest tightness?
No, doctor.
Okay. Any health any medical conditions before, like any breathing problems before?
No, but doctor, I have this high blood pressure, high fats in my body also. I'm taking medicines for them.
Mm-hmm. Okay. And what medication you are taking?
I'm taking Ramipril, atorvastatin, and aspirin. I just recently started this Ramipril.
Mm-hmm. Okay. Okay. So, Mr. David, do you feel any shortness of breath?
No, doctor.
Okay. Any swelling in the legs?
No, doctor.
Any dizziness?
No, doctor.
Okay. And any same conditions like in the family, like high blood pressure?
No, doctor.
Okay. Any high blood sugar?
No, doctor.
Mm-hmm. Okay. Any blood bleeding disorders you have, Mr. David?
No, doctor.
Okay. So, are you smoking, Mr. David?
Doctor, I used to smoke and I quit 10 years ago almost.
Mm-hmm. Okay. Um, and are you consuming alcohol?
No, doctor.
Any recreational drugs you are using?
No, doctor.
Mm-hmm. Any weight loss, Mr. David?
No, doctor.
Mhm. Okay. Any infection, any illness or flu before this cup?
No, doctor.
Mm-hmm. Okay. So what you are doing, Mr. David, for living?
Doctor, I'm a retired officer. I stay at home.
Mhm. And with whom you are living?
I live with my wife, and doctor, she's so much bothered with my cough, and I'm waking up at night also because of
Mhm.
this. And sometimes I'm not meeting my friends at night. They are saying you're always coughing. There could be some serious disease going on.
I can understand. We will talk about it. So, how are the any other stress at home, any financial or any other type?
No, doctor. No,
Okay. So, any okay. So, any stomach problem you have, Mr. David?
no, doctor.
Okay. So, Mr. David, we think that what do you have?
Doctor, maybe I don't know. It's my age factor. Even though I quit smoking so long ago.
Mm-hmm. And what's crossing your mind, Mr. David?
Doctor, okay, maybe it could be something serious like cancer.
I hope it's not. Okay, and what's your expectation from me in today's consultation?
Doctor, maybe this is big. You can give me some medications for it or change my medications.
We will talk about it. Okay, and Mr. David, how this condition is impacting your life?
I'm just waking up daily at night for this cough, from this cough, and it's bothering me and my wife.
Mm-hmm. Okay, so Mr. David, um, we will do some examination. Is that okay with you?
Sure, doctor.
Okay, I will sanitize my hands and under the chevron, I will do first general physical examination with the palm of the hands for to see any contractures, any sweating, and then I will see. Then I will check the nails and will check the pulse and blood pressure. I will ask you to just can you remove the shirt? If you need help, let me know.
Okay, doctor.
Okay, I will inspect the chest. Then I will put the palm of my hand on the four areas of the heart, and I will do the auscultation, and then on the four areas of the heart, and I will check the bases of the lungs, and will check the lower leg for the edema. Okay, and any findings?
Vitals 130 by 80. Otherwise, no normal air entry. Everything is normal. Mild throat
Mhm,
irritation on throat examination.
Okay. Okay, so Mr. David, you told me that you are using aspirin and Ramipril. Am I right?
Yes, doctor. Yes, doctor.
Okay. So, Mr. David, what's your body BMI?
24.
24. Okay. So, Mr. David, I think, okay. So the medicine you are taking for the blood pressure, like especially the Ramipril, I think this is the cause of your, cough, because one of the side effect of this tablet is cough, the dry cough. Are you getting me?
Yes, doctor.
So, what if I can change this drug to the another one?
Sure, doctor. That will be a good idea.
Mhm. Okay, so what I will do, I will change into the other drug like losartan. Okay, 50 milligram. Is that sound okay with you?
Sure, doctor.
Okay, and meanwhile, Mr. David, are you doing any physical activity?
No, doctor.
Mhm. Okay, so what do you have any pain in the joints?
No, doctor. I don't have pains.
Okay, so what if I can ask you to do physical activity of at least 30 minutes a day? Is that possible for you?
Sure, doctor.
And what about your eating habits, Mr. David?
I'm taking mostly home cooked food.
That sounds good. Okay, and your weight is already in a good range, so it's better if you can walk daily, and beside that, if you can reduce the salt, is that possible for you?
Sure, doctor.
Okay, try to eat more, homemade foods, and avoid this junk food. Is that okay?
Sure, doctor.
Okay, avoid caffeine and other caffeinated drinks like soda drinks. Is that possible? Is that possible for you?
Yes, doctor, I'll try.
Okay, so Mr. David, uh, yeah, I have changed this medicine for you, and then you can come to me after 2 weeks. Meanwhile, if you feel any dizziness, any chest pain, any swelling in the legs, you can come to me. Is that okay?
Okay, doctor.
Do you want to ask something else?
Do I need any tests?
I will. Okay, to be on safe side, I will send you. I will do the CBC, LFTs,
Time up.
RFTs, ECG. Okay,
Okay, Dr. Saima.
fine.
Dr. Saima, this patient, you don't have to do anything. You're going to stop the medication. Okay. So if like say you think that patient is high risk patient or having some red flags, then you can say about X-ray. But if you're saying about blood test, it will not be required. There is no requirement of that one. Okay, this is a classical case of AC inhibitor induced cough in AC induced cough, and this was a real exam scenario. Okay, so it was 2 marks. So I'm not saying anything. But when you're talking about history, doctor, you initially when patient told that you something that patient got recently changed the medication. From there itself, you have to cut short the history, differential diagnosis, red flags. You should not touch each and every point here. Again, doctors, you guys are doing very good practice, but when you are touching each and every single red flag, differential diagnosis, or part, so unfortunately, it will be giving you, doctor, uh, what you call it, the examiner will give you take a negative impact that you are having checklist. You're just ticking the checklist and you're coming out. So it means like say you don't have core knowledge, but you're working on a checklist. So please avoid this kind of practice. Okay. Otherwise, perfectly all right. Doctor, from your side, anything?
Yes, and safety netting was missing.
Yeah.
And if you want to, sometimes when we are changing medication, especially ACE inhibitors, cough, so only one test can be done: urea and electrolyte and potassium, especially potassium because it's producing the side effects. So one of the things, if they ask you, otherwise there's no need for regular blood test for it.
I want to ask if in the start the patient when we asked you have taking any medicine and said all that start taking Remipil, then no need to differentiate take time to take the history long for DD. Just to ask the main things and go forward.
Yes.
Dr. Azba, no, Dr. Azba, this is one point, one way. The second way, let me tell you, though you know from the day from line one that okay, this patient is having AC inhibitor induced cough, huh? But still, I have to touch the point, like say one differential or two differential, one red flag, hemoptysis or weight loss. Khalas. I'm not going to touch many points.
Okay, mean it means main red flags of the respiratory system we ask and then move forward. Don't
Yes,
touch
doctor.
each and every. Okay,
Not red
okay.
flag, but because cyst, doctor, when patient is having cough and cyst longer time, the duration is higher. So here we need to touch. We have to know about red flags also little bit, not too much, but we have to say that I'm going to see about patients any ongoing comorbidities like say maybe tuberculosis or bronchiectasis or whatever so on. So I have to rule it out, no? If like
So,
say if I'm going straight forward. They might consider it's a judgmental approach.
Okay, okay.
Yeah.
so we will stop the medication in this scenario,
Yeah, doctor, we'll stop the medication and we'll go with some other salt.
like no, like
Like
herbs.
say, you will
Herbs.
be using some sort of ARBs.
Herbs. Okay.
Okay. So you can use ARBs like say losartan or candesartan or valsartan. Anything, doctor, you can use it, but you should know that the dosage.
Hmm.
Okay, in case, for example, if you say that you forget anything, you can say in a simple word, this is it's a leniency given and you must be a safe doctor. So it is leniency given in the exam. Okay, I'll be checking from my BNF or my local guidelines and I'll come back to you.
Hmm.
You can say like this also. Okay, not every
Okay.
case, but some cases you can mention this way because sometimes we might skip something from our mind, no?
Okay.
Okay, doctor, who's
Okay.
next?
Dr. Kamlesh. Is Dr. Kamlesh
Can
here?
Yeah, Dr. Kamlesh is here.
Yes, ma'am. Hello.
Okay. So,
Yes.
Yeah.
yes, so your patient is Mrs. Laura, 30 years old
Mrs.
female,
Lara. Mhm.
came to discuss her problem with you. Please proceed with history, management plan, examination is gray.
And ma'am, what is the age? Sorry,
30 years.
30.
30 years. Okay.
Okay,
So,
doctor, start.
good day, Mrs. Lara. My name is Dr. Kumar. How may I help you today?
Yes, doctor, actually my heart went crazy fast and then they said it was something SVT. Now I'm scared it will happen again and also worried about tablets because I'm taking it daily. Hello?
Is Dr. Kamlesh,
Hello?
are you? I think Dr. Kamlesh will be holding the time for him. He's joining again. Yes, Dr.
Sorry,
Kamlesh.
sorry, disconnected. Yeah.
Okay, start
So,
again.
Mrs.
Start
Lara,
again.
can okay, sir.
Start again, doctor.
Sure.
Yes, doctors.
Yeah.
Start.
Good day, Mrs. Lara. My name is Dr. Kumar. How may I help you today?
Yes, doctor. Actually, my heart went crazy fast. Then they said that it was SVT, and now I'm scared
Mhm.
that it will happen again because I'm taking these tablets daily and I'm worried.
I'm sorry to hear about that. Can you tell me something more about your condition?
Yes, actually, out of the blue, my heart was thumping like they said that it is about 190 beats per
Mm-hmm.
minute, and then I felt dizzy and I was shaky. Then it lasted about 20 to 30 minutes, doctor.
20 to 30 minutes. Okay. And
Yes.
is it okay if I ask you a few questions about your condition?
Sure, doctor.
So when it happened to you?
It was last week.
Last week. So is what the first time you have the same in the past as well?
No, only this was the first time I ever felt it.
Okay. And you tell that you was like unconscious or you was just
I was
not able to do
conscious,
it? Mm-hmm.
but
Okay.
I was dizzy and shaky, and I couldn't like control my heartbeat, and that's why
Mm-hmm.
I went to the emergency. They did some ECG, and they told me I have SVT.
Okay. So you told that they have started for you some medication. Do you know the name of the medication?
Doctor, I don't remember the name, but they put me on some, and they said that beta blockers, heart
Mm-hmm.
tablets.
Okay. And after having this attempt, means any attack, do you have any same attack for a, even during for a shorter time in between?
Sorry?
Do you have the same type of problem again in between this 2 weeks?
Not in this 1 week.
Okay. And how many times it happened to you?
Doctor, it happened first time I went to emergency. Otherwise, my heart been racing off and on, but I didn't notice it much.
Okay. Did you feel any chest pain with that?
No, doctor.
Any difficulty in breathing?
No, doctor.
Any spinning of your head?
No, doctor.
Have you noticed that you are feeling cold while others are feeling hot?
No, doctor.
Do you feel you are low in your mood for last two to
No,
4 weeks?
no, doctor.
Have you felt that you are no more interested in the things which you previously were?
No, doctor.
Okay, and apart from that one, have you noticed any type of weight loss during this time?
No, doctor.
Are you suffering from any type of condition before, like high blood pressure,
Yes, doctor. Not high blood pressure, but I have this condition of asthma.
asthma? And since how long you have this condition?
Since I was teenage.
Are you using any medication on a regular basis?
Yes, doctor. I take this blue inhaler 1 to 2 times a week, and this
Mhm.
brown off and on.
Okay. Have you ever felt to wake up in the nights?
No, doctor.
Okay. And what do you do for the living?
I work as a teacher.
Okay. And Mrs. Lara, who is living with you at home?
Doctor, I'm living with my husband and one kid.
Mhm. Okay. Is it okay if I ask you a few personal questions if you don't mind?
Sure, doctor.
Okay. And when was your last menstrual period?
2 weeks ago.
2 weeks ago. So, do you drink alcohol?
No, doctor.
Do you smoke?
No, doctor.
Do you use more caffeinated drinks like tea, coffee?
Yes, doctor. One time last week when it happened, I took almost
Hmm.
3 coffees in the morning, and then I didn't take it again.
Okay. And how about me? What do you do for a living?
I'm working as a teacher.
Okay. And is there any stress in your workplace?
Yes, doctor. It's quite stressful sometimes.
Okay. And any stress at home?
No, doctor.
Any of your family member affected by heart problem?
No, doctor.
Any gland in the neck problem like thyroid?
No, no, doctor.
Okay. So, Mrs. Lara, what is your idea about your symptoms?
Doctor, is it some kind of short circuit in my heart, maybe?
And apart from this, is there any other concern for you?
Doctor, I'm worried about my medication. I don't know till when I should take it, and is this safe
Sure,
for my health?
sure. We will discuss about it. And what you are expecting from in today's consultation?
I just want a clear plan and a referral if it's needed.
Sure, we will talk about this and how this all is impacting on your regular life.
Doctor, since yesterday I feel quite like anxious because I was getting short of breath
Okay,
after walking, and I thought maybe this is because of my heart or maybe lungs. Then I'm here to visit you.
sure. So So what I have gathered in today's consultation, Mrs. Lara, that you have this effect attack 2 weeks before, okay, and after this you are feeling yesterday you are feeling that you have difficulty in breathing, and you think that this all can be because of your electric shock in your heart, right?
Yes, doctor.
Is there anything else you want to add?
No, doctor.
Okay, is it okay if I do for you your general physical examination as well as the examination of your chest, your heart area, as well as the gland in your neck called thyroid? Is
Okay,
it okay
doctor.
with you? Okay, and for this one, you have to remove your shirt up to upper chest area, and I will call the chaperone to help me out in this whole process. Okay with you?
Okay, doctor.
Okay, I will check for your hands. I will check for your pulses in both hands. I will check the blood pressure in your both hands. I will check, I will have to look at your chest. I have to tape it. I have to listen the sounds of the heart and as well as chest. I will also check the gland in your neck by having a look to touch it and to press it. Is it okay?
Okay, doctor.
Okay, is there any finding?
Vitals normal, heart sounds normal, mild expiratory wheeze, otherwise good air entry.
Okay, and so have to get an better understanding of your condition. Is it okay if I write for you few investigations?
Sure, doctor.
I will do for you your heart tracing today. I will send the blood samples for the complete blood count. For the TFT, it is called the for your gland in your neck. Okay, I will check your kidney status, electrolytes and function of the kidney. I will check your sugar levels. Is it okay with you? Anything in
Okay, no.
the okay, anything in the email? Oh, sorry, anything in the ECG? I mean, heart tracing.
Normal sinus rhythm.
Okay, so Mrs. Lara, as you are worried about this, is I tell you this condition is called the SVT, supraventricular tachycardia. As you already know about this, actually, what happens? This is a condition in which your heart is beating very fast because there is some
Mm.
abnormality in the electricity which pass through your heart muscles to work it properly. Are you getting me?
Yes, doctor.
Okay. So how about if I give you some lifestyle modification like may I know your weight according to your body weight?
It's 23.
23. So I will advise you something. Try to decrease the stress in your life. Do some yoga, exercises. Apart from this, try to avoid more caffeinated drinks. Okay. And take a good sleep. And I will provide you a leaflet to go through that. How to make a good sleep. We call it sleep hygiene.
Okay, doctor.
Okay, and I will give you a referral for the uh, specialist of heart, where they may give some other tests like we call it echocardiography. It is same like the scan of your heart. Okay, and if they get anything, they will treat you accordingly. Is
Okay,
it okay
time
with
up,
you?
Dr. Kamlesh.
Yeah.
Okay, doctor.
Anything else you want to ask? Thank you.
Thank you, doctor.
Okay, Dr. Kamlesh. Except few upside down, your case was up to mark, and that what examiner wanted to listen from you, you have expressed. But I just wanted to ask you, in the patient past history,
Mhm.
he was having asthma, am I right? She was having asthma.
Yes. So beta blocker.
So have you addressed his asthma?
Uh, Yeah, I was supposed to ask because she told 2 times. Yeah, I was supposed to how you are using the inhalers and for the beta
Yeah,
blockers as well. Okay.
yeah,
So,
exactly,
so
exactly.
I know,
So
but actually the thing is the pressure for the exam.
because that
Anyway,
was again classical
yeah,
scenario from
yes.
past paper,
Hmm.
okay, past exam. So whatever scenarios we're giving, these are from past papers now for the mock. At least we wanted to make sure that you guys are doing revision from the past paper for important topics. Okay, high yield means like say most commonly coming in the exam, so it will be easy for you not to look here and there. At least you'll be going straight forward. with your preparation, inshallah. So, doctor,
So
that was
I
another.
mean, so I was supposed to address like taking beta blocker because of the asthma, as well as how control
Yeah,
maybe not using the proper
yeah. How control
inhaler
asthma
technique.
inhalation technique? How she's using some inhaler or not? What was the inhaler technique? Because
Mhm.
patient examination finding respiratory
Yes.
was mild expiratory disease was there, good air entry, no otherwise. So it means I have to have that was a hidden agenda and that was a real exam scenario.
Hmm. Yes, sure,
Yeah.
I got your point. Thank you, sir.
You understand? So this kind of thing
Yes.
here, many candidates they say, Doctor, we did a very good. Yes, you did very good job, Doctor Kamlesh. I appreciate. But the thing that actual taste of that case
Hmm.
was little bit less salty. Means like say
Sure.
you have to address this what you say this asthma.
Beta blocker and asthma.
Yes, asthma. Yes, exactly.
And also, she told the beta blocker written.
Yes, yes, doctor.
Okay. So, yeah, safety
So
netting,
I
did
have
you do?
sorry, I have a question that in this patient, the patient has a
Uh-huh.
SVT because of the salbutamol. He's taking in too much salbutamol or like incorrectly, maybe. Please
Yes, doctor,
tell
and
us.
trigger factor. Another trigger factor is that she's taking too much coffee and tea.
Which I address, I think.
Okay,
Yes,
okay, okay.
yes, doctor.
Dr.
There are many.
Imran,
So
There are.
he,
here we will.
Dr.
Yes, doctor.
Imran,
Come.
he referred to the patient to specialist needed, you know.
It is needed, doctor,
Routine,
for
Okay.
routine.
further evaluation. Yes, because we wanted to to know about his safe rate control option, like say cardioselective beta blockers versus verapamil, because patient having asthma.
Yes.
We
Okay,
say
because
we
it will
stop.
be. Yes, doctor.
We say at that time we say stop the beta blocker and refer to this. We'll start the other medicine for this. We'll say
No,
like
doctor,
this.
it is based on doctor's specialist choice. Okay, here why we are going to send, we are going to send because we want him to get safe rate control because patient main concern was that if this thing happen in future again, what will happen? Okay, and if like say it is a recurrent, then they will be thinking about some catheter ablation, whatever so on. But here agenda was to refer plan and agenda was to refer the patient, okay, to cardiology for further evaluation and discussion of what will happen. They will do. They will think about some rate control medication option. Either it will be some medication or something what. And I have then agenda and the plan was to optimize the asthma because we have to check patient inhaler technique. Maybe patient is
So,
taking too
doctor,
much.
As here
Dr.
doctor
Imran,
said, I'm taking the doctor give me the beta blocker. I am worried that. So at that time we will address this agenda also that they will check this medicine to the specialist and it will decide it continue or not, or we will stop the beta blocker. We say you stop the beta blocker and we refer to and they will start. They will assess you and then if you need the medicine they will give you. As I'm
Uh,
asking this. Okay, we will
Da-
say anything about beta blocker, or we will just refer and say the specialist assessed you. Just
Yeah,
ask
but
this one.
doctor, it's not because of the beta blocker. It is because of caffeine. Because here in that one, when you see clearly and if when you see when you listen carefully this recording, then you will understand what was that actually the thing. Because here patient had a trigger. Because her trigger was three coffee that day. She had non-stop one by one. She had three coffee in the morning, and she was having stress at work. That was a trigger. Okay. So why it was, and she was using salbutamol only 1 to 2 times per week.
yeah. Dr.
Okay.
Imran, I have a question. So,
Yes,
I
doctor.
think I told her regarding the stress management about the caffeine, and I told her to, I will refer you, they will maybe do for you the scan of your heart.
Yeah, yeah, yeah.
So, I think there was anything else I was supposed to, apart from that one, to how to control your asthma, inhaler, and beta blocker,
Okay, doctor, we'll come to that one.
referral
And now,
reason.
yeah, okay. Let me complete Dr. Asba's thing. Dr. Asba, in that one, patient have had an episode, okay, when she was feeling thumping and she had 20 to 30, 190 heart rate, and that day she had three coffee and she was having so much stress, okay. But she mentioned there was some sort of distractor is there asthma. So asthma, then here I have to know about how much she is using inhaler, what was the inhaler. And so, for example, this patient was using inhaler for 1 to 2 times per week, and she was on low dose ICS. And there is not too much severe asthma because she never had any hospital admission. Here, my point: do you know how to use inhaler? Okay, even the patient having control asthma technique, but still we have to be a safe doctor. So we have to know how patient is using inhaler, whether inhaler technique is good or not. Now, Dr. Kamlesh, up to you. Now let me go for a management plan. Here, management, one thing you're explaining what is SVT. Okay. And we why to avoid what non-selective beta blocker because of asthma. And now my plan will be I'm going to refer to the cardiologist that you did for the rate control. You have to explain that what they will do. They will go for rate control options, okay, which is beyond my limits, like a verapamil or some other cardiac selective beta blockers. Or if patient having recurrent this condition, for example, some scenario might arise, so they might think about catheter ablation or whatever, so on. But here, if you are not mentioning catheter ablation, there is no problem. But optimizing the asthma is another mainstay. We have to talk in patient plan. Okay. For example, for all of you, please, if safety netting is not something that you're going to explain each and everything, I'll tell you one life fact. You say that if your symptoms get in worsen, please come back to us. You finish your safety netting. There is no such thing to talk about palpitation, heart attack, syncope, dizziness, chest pain, falling down, whatever. So no. Just simple. If your symptom getting worsen, please come back to me. Okay. This was the exam. This was the mentioned by the one of the examiner in orientation program. They said many doctors they are emphasizing on longer explanation on the safety netting. No, if you're running short of time, shorten your words, shorten your sentences, especially in the safety netting. You say if your symptom getting worse, please come back to me. That's it. You means you touch the safety netting. Alas.
Sure.
Yes, doctor, you want to add anything?
No, doctor, almost everything addressed. It's just
Okay,
this
doc.
case was SVT and asthma, so we need to see two things. That's it.
For asthma management, we also refer, or we will address his symptoms and as inhaler techniques and increase the dose like this.
But
We will manage
that's your
Yes.
asthma. Okay.
Yes,
that's
doctor.
your
No,
Mm.
doctor, it's based on a scenario. Doctor, for example, patient inhaler technique is good, so I am not going to incorrect his inhaler technique. Okay. For example, patient says I am having the inhaler technique is not good. Patient is not using properly, so we have to address. This is we call optimized asthma. Okay. For example, now she is taking ICS and inhaler this one, but she don't have. I have to think about some reliever technique. Okay, MART. New technique 2025 asthma guidelines we have to follow.
Regular
Okay.
and
Yeah.
SOS.
Okay. Next case, doctor.
Next is Mr. Robert, 60 years old male, came to discuss his problem with you. Please proceed with history. Examination is gray and management plan.
Hubbard, 70 years.
Yeah.
Okay.
Okay,
Yes.
sure.
Okay. Start.
Okay, good day, Mr. Robert. My name is Dr. Kumar. How may I help you today?
Yes, doctor. Actually, I went for a stool test and now it came back. So I just wanted to know what does it mean.
Sure, I am here to help you out, but can you tell me something more about your condition?
Yes, doctor. Actually, I was having bit more loose bowel habits these days, and but I was worried, and one of the GP wrote me this fit test. It is positive, doctor. What does it mean?
Okay, Mhm. Can I see your test results?
Yes, just
Fit is
fit
positive.
positive. Yes.
Okay. So, Mr. Robert, to understand better about your condition, is it okay if I ask you a few more questions about your condition?
Sure, doctor.
Okay. So, you told that you have before. Have you noticed any fresh blood in your stool before?
No, doctor. There wasn't any blood.
Okay, and apart from this, have you noticed any change in your habits of stools recently?
Only I was feeling more loose bowel habits.
What about the frequency of your stools?
3 to 4 times last week I was feeling every day.
Is there any pain with that stools?
No, doctor.
Okay, do you feel any bloating of your tummy?
No, doctor.
Any you want to throw up after eating?
No, doctor.
Have you noticed any weight loss recently?
Mm, no, doctor. I didn't notice any.
Okay, okay. Apart from this one, this test is showing there's fit positive. Do you have any idea what is in your result?
Doctor, I feel like this is positive for some blood, but I don't know where. I don't see any blood in my stools.
Mm-hmm. Do you feel any concern about your result?
Sorry?
Do you have any specific concern in your mind regarding your result?
Yes, doctor, I read it online and that it could be cancer.
Okay, and what are your expectations apart from to discuss this result with you?
I just want further testing and I want to know that what will happen next.
Sure. So, Mrs. Robert, regarding your condition, as you told me like that. So, is it? Can you just tell me? Are you suffering from any high blood pressure before?
No, doctor.
High sugar levels?
No, doctor.
Okay, and apart from what do you do for a living?
I'm retired officer.
Mm-hmm. Okay, and are you using any type of drug on regular basis?
No, doctor.
Okay, any of your family member has suffered from any cancer of the gut?
Yes, doctor, my uncle, when he was in 70s, he had this bowel cancer.
Okay, and with whom do you live?
I live with my wife.
Okay, and how are the things at home?
Everything is fine, but I'm worried, and she's also worried about my reports.
Mhm. And do you smoke, Mr. Robert?
Doctor, I used to smoke. Since last 5 years, I just quit smoking.
Yeah, I appreciated that you have done a very good decision because it has a good effect on your overall conditions, general condition. Okay, and do you drink alcohol?
Yes, doctor, I do take daily alcohol, but not a lot.
How how much?
2 to 3 glasses.
Okay. Is it possible for you if you can cut down a little bit of your alcohol, even it is in the normal range, but if you will go for and if you try it, it will also help you out for your general condition. Is it okay with you?
Doctor, I'll try it.
Sure. So, what type of person you are, Mr. Robert? You want to know each and everything about your result, possibilities, or just to know what does it mean for the fit positive test?
Doctor, I just want to know everything.
Okay, so Mr. Robert, this is a test. It is showing. We call it as a screening test. Screening test means if your age is like more than 50, okay, and you have this condition, it is showing that there's a little bit blood in your stool. So I am a little bit concerned, and you are concerned about that. You want to do some scans. So how about if I suggest for you some blood tests initially? Okay, like
Okay.
CBC, ESR, ferritin, iron levels. Okay, and to do the to do further treatment of treatment exactly. I will refer you for the gut specialist. Okay, they offer you a test. We call it the colonoscopy. Actually, this is a procedure in which they will pass the tube from your back down passage. Okay, and they will see the inside of the gut to know exactly what is the reason of this blood. Are you getting me?
Okay, doctor.
Okay. And okay. And just to check from my end, which I can do for you, I would like to do for you your general physical examination, like pulses in both of your hands, blood pressure in both of your hand. I will check the eyes for the color change. I will see your skin color change. Apart from this, I will do the examination of your tummy, including to touch it, to have a look at it, to tape it, and to listen the sounds of it. As well as I will offer you, if you allow me, to do the examination of your back passage. We call it the digital finger examination. Is it okay with you?
Okay, doctor. Patient looks well. BMI
Mhm,
slightly overweight and
mhm,
abdomen soft, non-tender. No masses, no
mhm.
fresh blood, no fissures noted on PR exam.
Okay. So how about if we discuss about your some changes in your regular life?
Sure, doctor.
Okay, as your weight is on a little upper side, so I would suggest you, are you doing any regular exercise?
No, doctor. I stay at home all the time.
So is it possible if you have some little exercise or have some walk at home on the regular basis to overcome your weight?
Sure, doctor. I'll try.
Sure. As apart from this, I will suggest you to have some dietary changes. Like you should take more good quality food, like which is low in fruits and fiber, high in fat and processed meat. Are you getting me? Oh, sorry, means
Yes,
more
doctor. I
fruits
will.
and more vegetables in your food rather than the fat and processed meat.
Okay, doctor.
Okay. So
Hmm.
as you are concerned about that, it can be something serious. So right now, I am not in the position to comment on this because this is the screening test, and this screening test is the reason we want to do some other tests to check whether
Um,
what is the reason of this blood in your stool. Are you getting me?
okay, so doctor. So you are sending me today to the specialist?
See, this is not an emergency. I will give you a referral, okay, towards the gut specialist on the urgent basis. Maybe they will give you a test 1 to 2 weeks time. In the meantime, I will try to fix an appointment with them, okay. And apart from this, actually, when you go home, okay, and anytime in between the gut specialist time to visit, I will tell you if you feel any obvious more blood in your stool, if you feel any pain in your tummy, if you feel any fever, any racing of your heart, you can proceed for the nearest emergency department. Is it okay?
Okay, doctor.
Okay. And apart from this, I will provide you the leaflet to read about the causes of the blood. And if there is anything from that you feel, you can visit me anytime, or you can
Okay.
we can fix another appointment for you so that we can discuss if you have any question in your mind. Is it okay with you?
Okay, doctor.
Okay, so Mr. Robert, apart from this, do you want to ask anything else, or if I forget something, you can ask me.
Um, no, doctor. That's all.
Okay,
Okay,
Dr. Kamlesh, time up.
thank you. Thank you.
Dr. Kamlesh, everything was perfect, but without examination and without
Yeah,
completing that tree, you
that's
should not explain the
yes,
thing.
yes.
Okay. Now,
Actually, I
doctor,
have
I'll be.
problem with the format. Actually, this is my big problem. Actually,
No worry, doctor. No worry, doctor. Let me tell you, doctor, one thing. If, like, say, in case there are three scenarios might arise in the exam. One scenario just now we given you that positive result, patient come with false positive fit result. Sometime patient will come, elderly patient, 65 years old gentleman. It also came in the exam. Doctor, I saw the blood in my stool, or my stool color change, or I am experiencing unexpected weight loss. Okay, that is also cancerous pathway.
Hmm.
Hmm? Okay, here what will be patient? Patient will come with a change in bowel habit. Either it is a frequency, it is a consistency, or urgency. One, rectal bleeding, maybe fresh blood mixed with stool, paper in the pan, on the paper or in the pan, might be failing in the bowel. Sometimes patient will come with abdominal pain and bloating with weight loss and incomplete evacuation. Many time patient will say that I'm having incomplete evacuation. So, with the symptom, what are the red flags which will want us, which will warn us actually to go for a cancerous pathway, which will be unintentional weight loss. And if patient come with a serum or say a full blood count result, hemoglobin shows 9 in the male. So we are going to see that serum ferritin and other things. So it will be iron deficiency anemia. Patient will be having fatigue, exertional dyspnea, patient feeling tired, he can't stand up and persistent and unexplained abdominal pain, palpable abdominal mass or rectal mass, patient says, but or patient having examination finding, or patient having a strong family history also is a red flag. Okay, and now
I think I
duration.
touch all the areas, family and consistency. I think
Yeah,
I
yeah,
feel like, but I'm
yeah.
not
But
sure.
I'm giving you one in a broader
Yes,
aspect that it will cover two to
yes,
three scenarios at one time, so
scenarios.
we don't have
Yes.
to go repeatedly. Okay, okay. And now pattern, duration and pattern, I told you that how long symptoms have been present or any progression or worsening. Background, again, personal history of colorectal polyps or cancer. Maybe patient having some follow-up under gastric, okay, or inflammatory bowel disease, IBD. Family history of bowel cancer and polyps, polyposis in syndromes in family. Lifestyle factor, patient smoker, patient is alcohol, patient having a spicy diet, light, low in fiber, patient is obese. Okay, these are the focus history part for any kind of GI cancerous pathway. Now examination, doctor. General physical examination, what we're going to see about if patient having pallor signs of chronic disease or weight loss or BMI difference is there. So we have to talk about abdominal examination. You might get it on palpation. You will be getting masses, organomegaly, and tenderness. Don't forget that I will be doing your rectal physical examination. Okay, though you are not going to perform it, but they will give you the finding. Investigation in at our GP level, doctor, not too many and not so many and not to focus on many investigations. Okay. For our level, if like say patient already had a detected positive FOBT in this case, we will not do any test before colonoscopy because in this pathway already it is defined that patient having FOBT positive, there is no point to do the full blood count and ferritin. If it is not checked before, you can say that I will be doing to check about your anemia status. I agree. But the thing, if it is since it is done or as FOBT or other thing, so it is not considered, it is not recommended. Urea electrolyte and coagulation profile, if it is requested by the endoscopy services, then we can say that I will be doing. Otherwise, no. Management and referral, again, that is a different, two different protocols are there. One is asymptomatic and mild symptom. With positive screening test like your case, we're going to explain as you did, need of colonoscopy and to look for what? You are not saying that you're going to see for bowel cancer or something. They
No,
will be looking for,
I told that they
yes.
will see the inside of your gut to check the renal failure.
That was a perfect, explanation by you. That was perfect explanation. Okay. And for the symptomatic with red flags, positive, fit or plus red flag symptom, we will be treating this patient as a high risk for colorectal cancer. Here we are going to send for urgent species assessment. Okay, that
1 to 2 weeks,
fellow will
right?
be 2 weeks, 2 weeks referral. This
Yeah.
is urgent referral.
Mm. Okay.
Okay, if patient having anemia, obstruction signs are there or systemically unwell, this is urgent admission, doctor. Okay.
Yes,
Now,
vitally.
yeah, there are some phrases are there where there are common pitfalls are there in such a breaking bad news and this kind of cases where patient come with report. Number one, doctor, reassuring too strongly without emphasizing the need of investigation. You understand what I mean, Dr. Kamlesh?
Yes, yes.
This is number one pitfall. Number two pitfall is that failing to ask about red flag symptom because I saw the report, I didn't ask, or family history. I forget because I started talking on that road because oh my goodness, this is a fit positive report. This is my case pass. I'm pass. So I will be
I
just
think
starting
I asked
doing.
him or
Yes, you
that
did.
time.
You did.
Yeah.
Just I'm telling you, these are the pitfalls,
Yeah,
doctor.
yeah. Means pitfalls. Yeah,
Okay,
sure. Thank you.
and not safety netting about worsening symptom or delay because I'm going to refer this patient after 2 weeks. Patient is going to see 2 weeks. What will happen within 2 weeks, doctor?
Abdominal
Okay.
pain, more bleeding,
Yes,
and
exactly.
tachycardia,
Yeah.
dizziness,
And for
unconsciousness,
example,
and
you saw fit test done was done on 1 month ago. This is one of the important and interesting pitfall where candidate fail. Okay, ordering unnecessary repeat fit instead of following the established screening pathway. Already this is established, doctor. There is no need to repeat the fit. You understand? So there are 6 things are there. You guys are going to take as a home structure or home message for this kind of cases. First, you have to confirm the understanding of the positive screening test and what patient knows about and how much patient knows and how much he want to know. Okay. Number two, doctor, briefly explain what FOBT and what for and what a positive result means that you did. Screen for the symptoms and red flags and examination if appropriate. Number four, doctor, ensure or initiate appropriate referral. Like say, if it's a non-urgent, I'm going to refer for 2 weeks. If it's urgent, as I can say, so I'm going to send urgently, or I'm going to admit the patient if patient having symptomatic problem, symptomatic symptoms. So patient is symptomatic. Okay, I have to provide clear, balanced information if it is needed, and safety netting. Don't forget. These are the things, doctor. So, doctor, you want to add anything?
No, doctor. Almost Dr. Kamlesh went through everything. There wasn't any pitfall, but the pitfall for everyone else. If they skip it, the case might go
Yes,
bad.
doctor, because we have changed a little bit agenda for the mock for everyone. Let me tell you, because we are not going to see this case as one case. We are going to see as a number 2 or 3 case scenario, different way to give you some sort of vast idea. And at least you guys don't have to read many pages. At least you will be getting to the point information to capture that different scenarios and different possibilities in one scenario itself. Okay, it might be one scenario, but it will come as a different script, like say 5 scripts or 6 scripts will be there with one scenario only. Okay, it's little bit changes and it will change whole treatment and whole management plan. Okay, doctor, next case.
Next case, Dr. 7, case number 7.
Case
All
number
right.
7. Okay.
Hmm. Dr. Kamlesh, your patient is Miss Shaista, 36 years old female, came to discuss her problem with you. Please proceed with history, examination, and management plan.
okay. Miss Shaista, 36-year-old.
Yes, doctor.
Yes.
Okay, so good day, Miss Shaista. My name is Dr. Kumar. How may I help you today?
Doctor, I'm exhausted and I've put some weight also.
So, Miss Shasta, can you tell me something more about your condition?
Yes, doctor, even though I'm not eating a lot, I'm gaining the weight and I'm
Mm-hmm.
freezing all the time. Like I'm feeling so much cold
Mm-hmm.
and I don't know, I feel fatigued.
Okay. So, Miss Shasta, is it okay if I ask you a few questions about your condition to understand better? And during our conversation in today's consultation, I may ask you some private and personal questions if you don't mind.
Sure, doctor.
And I assure you, whatever you will talk in today's consultation will remain confidential.
Okay, doctor.
Okay. So you told me that you are feeling that you are increasing, your weight is increasing even if you are not eating more, and you are feeling more cold, right?
Yes, doctor.
Okay. So first of all, can you tell me since how long you are feeling this?
Since last 6 to 9 months now.
6 to 9 months. This all started suddenly or gradually?
Gradually.
Gradually. Okay. And apart from this, do you feel there's any specific time of the day you are feeling more coldness, or anytime you can feel it?
Anytime, doctor.
Anytime. Okay. And have you noticed any type of like you are feeling tired?
Yes, doctor, I feel so much tired and I cannot even concentrate on my work.
Okay. Apart from this, have you noticed any disturbance in your sleep? Are you feeling
I'm
more
feeling
sleep?
more sleepy. Yes.
Mm-hmm. Okay. Have you noticed any hair fall?
Yes, doctor, my hair are getting thinning.
Okay. Is there any dryness of your hair as well?
Yes, doctor, and I have to apply moisturizer a lot on my skin. I feel my skin is getting dry.
Okay. Any change in your voice?
No, doctor.
Okay. And apart from this, have you noticed any problem in your regular menstrual cycle?
Yes, doctor, I'm getting more heavy periods.
More heavy periods, along with the same since last 6 months or more,
Yes,
right?
yes, doctor. Yes.
Okay. Have you noticed any pain in your muscles, in the like
No, doctor.
shoulders or in your hip in the morning?
No, doctor.
Okay. Have you noticed any color change in your stool?
No, doctor.
Okay. Have you ever suffered from any problem in your neck glands, like thyroid?
No, doctor.
Have you noticed that you are no more interested in the things which you previously were?
No, doctor.
Have you noticed that you are low in your mood since before?
Yes, doctor, I just don't find energy and I cannot concentrate.
Mm-hmm.
Otherwise, I'm fine.
Sure. And when was your last menstrual period?
3 weeks ago.
3 weeks ago. And apart from this, have you ever suffered from any high sugar levels?
No, doctor.
Okay. Any high blood pressure?
No, doctor.
Are you using any type of medication for over-the-counter or regular basis?
No, doctor, but sometimes I'm just taking this painkillers when I'm feeling fatigued all the time. I just take paracetamol.
Okay. Okay. Does it work for you?
No, doctor, not a lot.
Okay. And what do you do for the living?
I'm an office worker in a bank, and I'm really
Mm-hmm.
struggling with my job.
I can understand office jobs are always like very difficult. So, is there any stress at workplace?
Yes, doctor, I cannot finish my work all the time. I'm low in energy, so my
Sure,
work
I
is
can.
pending.
Sure. So, with whom do you live?
I live with my husband.
Mm-hmm. And do you smoke?
No, doctor.
Do you drink alcohol?
No, doctor.
Okay. So, you have told me, do you have any idea that what's going on?
Just, doctor, I think it's a kind of a gland disease like my mother has.
Okay, your mother has and how she is doing,
And she's on medication.
and she's going good, right?
Yeah.
Very nice to hear about that. And apart from this, is there any specific concern come in your mind regarding your condition?
Doctor, I want to know, is it permanent or will it affect in my fertility?
Sure, we will discuss about it. And what you are expecting from me apart from to discuss this issue?
Uh, just want any blood test or medication.
Sure. And in any sense, how you feel that this is impacting on your regular life, and in what sense?
And doctor, just you can see I'm just affected with my low concentration mode and my physical health is deteriorating. Yeah,
So,
so I'm anxious.
ma'am, what I have got through today's consultation, actually, you are feeling you are increasing your weight, you are feeling tired, you are unable to perform your work in a better way, right? And your
Yes,
menstrual
doctor.
cycle is also disturbed. Is there anything else you want to add?
No, doctor.
Okay, so to have a definite diagnosis, how about if I do for you your general physical examination?
Sure, doctor.
Okay, for this I will take a help from my chaperone to come and help me out getting your examination. And for the examination, I will have to do for you your general physical examination, like your weight. Apart from this pulse in your both arms, I will check your hands for any dryness or any moistness. I will check for you the blood pressure in your both arms. I will have a look at your neck from front as well as from behind. I will give you a test. We call it a sip test to take a water sip from the water. Okay. I will see the movement of your neck gland. I will touch it. I will press it. I will see the trachea. And apart from this, I will check the glands in your neck. We call it the lymph nodes. Also, I will listen with my stethoscope, the sounds in your gland area. Okay. And apart from this, I will check the uh, your biceps and triceps. These are the muscles to see the movement of these muscles. Okay.
Okay.
Anything in the examination?
BMI 28, pulse 58, dry, cool, and skin and hair coarse. Thyroid is diffusely enlarged, firm, and no nodules present.
Okay.
Delayed
So,
reflexes.
okay. So, is it okay that I will do for you some lab test for you?
Sure, doctor.
Okay. I will do for you your complete blood count. I will check for you your thyroid function, which is a gland in your front of neck. Apart from this, I will check for you your fasting sugar, fasting lipid profile. Also, I will check some antibodies for your neck gland. Okay.
Okay. TSH is raised, free
Mhm.
T4 low, thyroid
Mhm.
antibodies positive.
Okay. So, after having this all condition in and all your lab tests, actually you are suffering from a condition we called it hypothyroidism. Are you getting it?
Yes, doctor, like my mother.
Yes. So actually, this is a condition. Do you know about this hypothyroidism?
Doctor, it's just I need to take medication. I don't know. It's underactive.
Yeah. Actually, this is not producing the enough thyroid. Means these are the enzymes. Sorry, these are the hormones in your gland. Okay. As you told, as we are discussing that your one level TSH it is increased and the main hormone which is T4 is decreased, means they are underperforming actually, and that is because of that you are feeling this all increase in your weight, problem with your menstrual cycle as well as lethargy. Are you getting me?
Yes, doctor.
Okay. And how
Okay,
about if I
time up,
will?
Dr.
Mhm,
Kamlesh.
mhm, sure.
Okay, Dr. Kamlesh, well done. Dr. Kamlesh, before giving you comment on that, I just wanted to give you comment on your some performance technique there. I have found out that you are using mainly the word less sentence. Can you tell me? This is we call it interrogative.
Ah,
Okay,
okay.
it's not it is not giving a positive impact on the examiner. So we call it
Yes.
interrogative, not a patient-centered. So here you have to replace with that may I know, Mrs. Sal?
May I know?
Okay.
May I ask?
Okay. Are you comfortable to tell me? This kind of sentences where you call it appealing, okay, requesting style. Okay, your appreciation is always good overall. You're appreciating the patient. That is a positive point. But while doing examination of the neck, you have to ask before performing that, do you have any neck pain or discomfort? Or at any point, if you feel discomfort or pain,
Discomfort, you can
please
stop.
let me know. Yes. Because if you are not doing and your technique is perfect and patient is feeling discomfort, please don't do. Second thing, doctor, for everyone. Whenever we are going to examine patient, you should not do actively change the position of the patient, like say pulling the chest, chin up very hardly, harshly, turning neck right, left. Maybe SP himself having some problem and he will suffer from that one, huh? Maybe during the limb examination, I'm pushing patient, pulling up patient's shoulder, or while helping his or her dressing and undressing, I'm doing. This is a negative and pitfalls in the exam. Okay. So, doctor, otherwise, when I was looking at your things was not, I don't have to do anything, but have you
I
ordered
think I
any
dragged
anti-TPO?
this one. Yeah, I told I will do some hormone and antibodies for your neck gland.
Oh, okay. Okay.
I think I went deep in the, I think,
And you are
the
asking
questions.
so
So
many
many
doctor
questions, yeah.
so many
Yeah,
questions. Cut down
yeah,
this
it
thing
was,
because
yeah.
it is taking up your time, doctor. That is which is one of
That
the
is why I
most
put in reach.
one of the most precious and crucial thing for us while examining and doing examination or doing something. Okay, because if we are not doing this thing, so definitely we will fall beyond.
Dr. Imran,
Yes.
Yes, doctor.
in this case, as she said that I'm worried about the fertility, and she is married, and her cycle was 3 weeks ago. Should we do the pregnancy test?
Yes, doctor.
Okay.
Logically, we have to do. Okay, logically, we have to do this test. That is recommended. So, doctor, from your side, you want to add anything?
Yes. So regarding the fertility, every time the hypothyroid is coming, we need to ask less and talk more because, and also the contraception needs to be noted. They might be on some implants or any hormonal pills for their weight gain, and we need to address that also. But in general, the management plan is very extensive in this case, so we have to like cut short our history. So, Dr. Hima, I was thinking if we just give a brief in the middle at 5 minutes,
Yeah, I'm not
so
getting you what you
the
say.
candidate, like in the 5 minutes, we can tell the patient, the candidate that the 5 minutes are over.
Yeah, that's what I'm also thinking because time taking is too much. So they have to stop wherever they are. I think we decided, but after that,
Yeah.
I think
Since these are the mocks, so everyone needs to like control their time limit. Management plan should be 3 minutes. 2 minutes will be taken by examination anyhow in the exam. So you are left with only 5 minutes. Time management is major problem with so many candidates. Even though they know everything, the case was so easy, but they couldn't complete it just because of time management. So from now on, we can bleep in the middle, like it's 5 minutes over and then 5 minutes remaining, things like that. So next case, um,
I think
Dr.
next
Sumaira.
Dr. Sumera is there.
Yes.
Yes, Assalamu alaikum. Yes.
Alaikum salam.
Okay. So your patient, it's case number 6. Your patient is Mrs. Aisha, 29 years old female, came to discuss her problem with you. Please proceed with history examination. Examination is gray and management plan.
This is Aisha, 29 years old. History and examination is gray. Okay.
Yes.
Okay, let me know when to start, then I will.
Okay, doctor, start. Doctor, case number?
Hello.
6.
Okay, okay. You can
Hello.
start.
Hello. My name is Dr. Sumera. Hello, Mrs. Aisha. My name is Dr. Sumera. Please tell me what brings you here today.
Doctor, actually, I'm 4.5 months now. I'm pregnant now and just want to make sure everything is okay.
Mm-hmm. Okay. Is this? Please tell me more about it. Can you tell me more about it?
Yes, doctor, actually, I was going for a routine checkup for my GP, but I guess she's on leave, so I came here because she asked me to come on a regular visit. So before that, I had every kind of blood test, and they told me everything is fine. But now, I want to know it's everything going smooth or not.
Mm-hmm. That okay. Mrs. Aisha, this is your first pregnancy.
Yes, doctor. Sorry, this
Okay.
is my second.
Okay, and congratulations on getting on this pregnancy, and it is very good that you came here. Okay, first of all, tell me that are you following with your woman doctor?
Yes, doctor, I'm following because
Okay, what is the date of your last menstrual period?
it's 18 weeks ago.
18 weeks ago. Okay, tell me, do you have any tummy pain,
No, doctor.
any bleeding from down below,
No, doctor.
any do you feel a baby movement?
Yes, doctor.
Mm-hmm. Okay, and tell me, do you feel any kind of nausea,
No, doctor.
vomiting,
No, doctor.
any headache?
No, doctor. But I feel the racing and pacing of my heart sometimes.
Racing and pacing of heart sometimes. Okay, since how long you're feeling this?
Just few days ago, I didn't give it a thought a lot, but now I think that it could be something serious.
Okay, is it continuous or off and on?
Off and on.
Okay, apart from this, is there any other complaint?
No, doctor.
Okay, tell me that like what is the age of your first baby?
It's 2 years old.
Is this pregnancy was planned or unplanned?
This wasn't planned, doctor.
Okay, were you using any type of contraception?
No, doctor.
Okay, tell me, do you have any long-standing illness?
No, doctor.
Are you using any medications currently?
Yes, doctor. Yes, I've been
Which?
taking these folic acids and on
Mhm.
vitamin D also.
Folic acid and vitamin D.
Yes, folic acid I took till 12 months. Oh, 12 weeks, and now I'm taking vitamin D only.
Okay, are you taking regularly?
Yes, doctor.
Okay. Is there any history of previous abortions or, sorry, miscarriages?
No, doctor.
Any history of hospitalization?
No, doctor.
Okay. Is there any is there any long-standing illness in your family?
No, doctor.
Okay. Um, Tell me, what do you do for your living?
I'm a housewife.
Housewife. Okay. Do you smoke?
No, doctor.
Do you drink alcohol?
No, doctor.
Is there any stress in your life related to your like a spouse or something?
No, doctor. My husband is supportive.
Okay, that's good. What about your daily dietary routine?
I'm taking balanced diet.
Mm-hmm. And do you do any physical activity?
Uh, I just do light yoga.
Okay. And tell me, which thing is crossing over your mind right now?
I think, doctor, like the baby's fine, or I'm not sure. I just want to know about the baby's status.
Sure, sure. I will definitely talk about it. And what is your, which thing is worrying you the most? Anything worrying you the most?
Recently I don't feel as many kicks yet, and as I remember the last time in my previous baby.
Like last time when you feel the kick?
The morning.
Morning. And okay. And after that, you didn't feel any?
Doctor, it's not a lot, like in my first pregnancy. It is there, but it's not a lot.
Okay, I will examine. Oh, okay, I will check. And tell about what are you expecting from me today?
I just want you to hear the baby's heartbeat and I want to know like
Sure.
what should I do further.
Sure. Okay. Mrs. Aisha, let me summarize that you are 4.5 weeks pregnant, and this is your unplanned pregnancy, and you are thinking that is your baby is fine, and you are saying that you're feeling less kicks since morning,
Yes, doctor.
and you want me to check you. Okay, is it
Yes,
all?
doctor. Yes.
Okay. So I want to examine you. Can I examine you?
Sure, doctor.
So in the presence of in complete privacy and in the presence of chaperone, I will examine the patient. First of all, I will check the vitals, all the vitals, blood pressure, temperature, respiratory rate, and oxygen saturations, and patient BMI also. And I will ask the patient, could you please lie down? And I have sanitized my hand. Okay, could you please lie down? Then I will check your. Could you please remove your shirt? I want to check your tummy, Mrs. Aisha. Okay.
Okay, doctor.
If you feel any pain, let me know. Okay. First of all, I will do an inspection. Then I will do light palpation. I will check the fundal height. I will check the fetal heartbeat. Okay. And I will ask also if do you have any spotting or by any chance any bleeding down below?
No, doctor.
Okay, I will check the pedal edema. I will check the anemia, jaundice in the eyes and the nails, and I will also check auscultate the chest quickly.
Okay, blood
Okay.
pressure is
Okay.
110/70 and
Okay.
fundal height is according to the dates. Fetal heart is
Okay.
regular.
Okay. Oh, okay. Miss Aisha, please sit down and let me cover you. Do you need any help? Okay, sit down. Okay,
Okay,
Mrs.
doctor.
Aisha, what you have told me, and I have examined you. Your baby is completely fine, and the heart rate is fine. So, what we do is that I will advise you some test. Okay, first,
Okay,
is it
doctor.
okay with you? Okay, I will.
Sure, doctor.
Have you done any test previously?
Yes, doctor, my only screening tests were done at booking visit.
At booking visit. Okay. I just want to repeat your few tests. Okay. Have you done your nuchal scan and that one screening for Downs and all these things?
I don't know, doctor. One scan was done at 12 weeks, but
Mm-hmm.
I don't know other scans. They said it's dating
Okay.
scan. I did at 12.
Okay. Okay. No problem. Okay. I will repeat your full blood count. I would like to do your urine dipstick. Okay. And I will do one scan of your tummy. And I will like to do some what was your blood group? Do you know any of your blood group?
I don't remember, but it's in the reports.
Okay, so I would like to do your blood group, your RH antibody status. I would like to do hepatitis B, syphilis, and rubella test. And one more thing is that you are saying that you had a racing and pacing of heart, of your better to take a regular do regular light exercise, eat healthy. Okay, and try to monitor your baby's kicks. If you don't feel any kick, okay, try to lie down on the left side and try to count. And if you feel that you have any kind of tummy pain, any bleeding from down below, if you feel any headache or any symptoms unusual symptoms, you can come to the emergency or you can come to me. Are you getting me?
Okay, doctor. Okay,
I
doctor.
am
But
also
which
giving you a
scan you're
leaflet.
telling?
Yeah, I am writing a nuchal scan, translucency scan for Downs.
Okay, doctor. Okay,
And
doctor.
I am also giving you a leaflet regarding your condition, and you can read it at home. And if you want to know anything, you can come to me.
Okay, doctor.
Okay,
Thank you.
Dr. Sumaira, time up. So, Doctor, over to you. What you wanted to say, your expert opinion. Uh,
Okay, so um, yes, doctor. Dr. Sumaira, why you said knuckle translucency scan?
Because it was done in between. Yeah, patient was 18 weeks now, so it might be possible that it
Oh,
has done already. But I thought because she has not brought any reports and anything, so that is why I said I think
she.
I shouldn't do that.
Okay, so
Yeah.
if we go from the beginning, you almost asked everything that was needed to ask, but actually, this pregnancy was her second. The normal
Yes.
flutters or normal racing and pacing is quite common when in the late days of pregnancy or late trimester, until unless she is having any shortness of breath or any severe kind of physical
Hmm.
deterioration. Until then, it's kind of normal. So, secondly,
Hmm.
what we have to do over here, the whole agenda of the case was the anomaly scan. Okay, you
Okay.
did examination, you eyes asked about her family history. Your history taking was fine. You touched each and every point, even contraception also. So everything was fine. But in investigation, we don't need to repeat a lot of tests over here. Only just the anomaly scan. Here we need to say anomaly scan at 20 weeks. Okay, for
Okay.
that we will be booking her because she is doing the routine checkup to you. She might not come after this for long. So for at least 20 weeks, at 20 weeks we need to. Okay, this might be.
So,
Okay, so
okay,
in the
doctors,
management.
I'll be leaving now because I have duty. So I'll be leaving over to
Okay.
you guys, and thank you for joining, everyone. And shortly we'll be because we got already our official status to upload the videos on our channel. So we will be uploading once recording available. We will upload it today itself, inshallah. Okay. And other two videos are already uploaded yesterday and day before yesterday one. So please check on that. Thank you. So I'll be leaving. Thank you very much,
Oh,
everyone.
Thank you, doctor.
thank
Thank you
you,
so
doctor.
Thank you,
much.
doctor.
I
Okay,
want
so
to
Dr. Samira,
uh,
Yes.
I cut
Dr.
you at any
Musarat, I
point.
want to ask, as patient seeing here that heart is racing, can we repeat the only along with the anomaly scan with the CBC because patient didn't know the HB and now taking the ferrous iron after 12 weeks. So can we repeat
Yes.
this and start the iron also at that time?
Yes, it can be started. And since she doesn't know, or sometimes they give you their HB reports when it's the hidden agenda, or you can say when that iron needed to be started. But here, she's not taking iron tablets, and you can repeat the CBC. Okay, that's not a big deal. Only the important thing, even you skip the CBC, the patient might come back at 24 weeks of regular or routine checkup. That can be done after that. But this anomalies can, if you forget this, then it cannot be recovered again. So 16 to 20 weeks, whenever the patient is coming, just keep in mind if this is anomaly
Yeah.
scan you need to do.
Okay. I just
So
forgot
first thing,
that when to do anomaly scan.
yeah.
Okay.
And in every case, we need to at least address the patient concern. She's thinking is there something wrong with the patient. So always start your management plan with the reassurance if there is any. Tell her that findings are normal at this stage, and your baby, I can hear your baby's heartbeat. As she was saying that I want you to hear the heartbeat of the baby. So you can tell her the
Mm.
heartbeat is fine, baby is doing good, you are fine, but still I need to book you for an anomaly scan at 20 weeks. And you can tell her
Mm.
that if they ask you what are you, why are you doing this for? You can tell for the normal growth of the baby and the organs. Okay. Lifestyle, just tell her the healthy diet, safe exercise, and avoid alcohol and smoking if she's taking any. And
Okay. Mm-hmm.
safety netting. Otherwise, it's fine. The case was done.
But
Just
I
this
think I
anomaly.
only missed the anomaly now, Dr. Musarat.
Yes, but this was
And
really important.
and but they will fail on this point. They just
No,
like
I hope not,
don't.
because they don't fail your the case. They don't fail your case actually. The
Yeah.
marks will be
Okay.
detected. There will be negative marking of asking any weird question, but they won't just fail altogether. There will still be marks of your case that's failed. So don't worry about that. They won't just write fail over on one thing. Okay, they will
Okay.
be doing tick
Yes, you're
marking for
correct.
everything you are asking. Okay, so don't worry like on one question, but yes, when the thing is important, it's very important. You need to follow this. Okay,
Yes. Okay. Sure.
next,
Thank you. Yeah. Yes.
your next
Dr.
case is
Musarat, actually, sorry, I'm just adding one thing. Actually, she was mentioning, but she didn't mention anomaly scan. She said the
hmm,
wrong word, like
anti-scan.
translucency. Yeah, actually,
Yeah,
she
translucency
this
is
this
in
was
the
this
11 to
was in her
13.
mind. Yeah, this was in her mind, but I think maybe she like
Yes, yes, she did a
may,
scan. Obviously, even though she's sending for anti-scan, still
mm,
the things will be picked up. But anti-scan is on 11 to 13th week and the early booking.
yeah, yeah,
It's a normal.
yeah, 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 yeah.
Okay, so
Okay,
we
okay.
still have to like the examiner might raise their eyebrows like anti-scan on 6-18 weeks. So
Mm,
still we need to
mm.
be very careful.
Yes, yes. Now I got the point. Like this was
Yeah,
not being said by her. Like the anomaly scan was the approved. Okay, I got it.
yeah, FOD.
Okay, thank you.
Okay. The next case is Mr.
Mm,
Mr. Abdurrahman,
mm,
34-year-old male, came to discuss his problem. Would you please proceed with history examination and management plan? Just give me a second.
34-year-old Abdul Rahman, history examination and management plan. Okay.
Yeah,
I will set
44.
44. Okay.
Yes.
I will start my timer also. Okay. Should I start?
Okay, and yeah, start now.
Hello. Good afternoon, Mr. Abdul Rahman. My name is Dr. Sumera. Please tell me what brings you here today.
Doctor, since a few months, like 2 months,
Mm-hmm.
my knee is being paining a lot and swollen now.
Mm-hmm. Since few months. Okay. Sorry to hear
Yes.
about it. Could you please tell me more?
Yes, doctor, I was not taking it not giving it attention, but it started become swollen and it's now hot and really painful and I can hardly walk, even though I'm taking my medication daily on time.
Mm-hmm. Okay. So, this hot and swollen and painful knee that happened since how long?
Since two months.
Since 2 months. Okay. Which knee is this?
This is right.
Right knee. Okay. Tell me about your pain. Like this pain is going anywhere? Like it is only in the knee area, or it is going somewhere?
Only in the knee area.
Okay. On the basis of severity from 1 to 10, 1 is a minimum, 10 is a maximum. How will you rate it?
8 out of 10. And
8
worse
out
on
of
the
10.
movement. Hmm.
Worse on the movement. So you have when you get up in the morning, do you have any stiffness or pain early morning?
No, doctor. And Dr. Sumera,
No.
sorry, it's 1 week ago. It started 1 week ago.
Yes, I was okay. 1 week.
Yeah, sorry.
Okay.
Yeah.
Okay, no problem. Okay, 1 week ago. Okay, tell me that this pain. Do you have any fever with it?
No, doctor.
No fever. Okay. Are you comfortable, or do you want me to give you any painkiller?
Doctor, I've been applying this grouping gel over it and it's relieving me for a while, but now I cannot even move or do my daily work.
Sorry to hear about it. So, you feel that this pain is aggravating on walking.
Yes, doctor.
Okay. And okay. Tell me that do you have any by chance is any history of trauma?
No, doctor.
No. Okay. Tell me, do you have any kind of, you say there is a swelling in your knees also.
Yes, doctor. Yes.
Is there any redness also?
Yes, doctor. It's red and hot and painful.
Can I see your knee?
Okay, I'll pause the timer.
Yes, please. It's a left knee, na?
Right.
Right knee, okay. Just let me know कि ना वो आपने शेयर किया तो मैं जाके देख लूंगी उसमें से व्हाट्सएप पे
Okay. This
देख लूं
in
हो
the
गया
WhatsApp
शेयर
group. Yes.
जस्ट 1 मिनट मेरे पास तो नहीं आ रहा अभी
Yeah, it's sending.
ओके ओके
In the picture, it's on the other side, but actually it's the right knee.
okay got it okay okay you can start the timer
It
should I start
starts now.
okay okay Mr. Abdul Rahman, tell me, do you have any long standing illness?
Yes, doctor, I'm taking so many tablets. And I have
Please
this
tell me.
recently I got medication for my TB drugs.
TB drugs. Okay, you have it. Okay. So you have TB. Since how long you are
Yes,
taking these
doctor.
TB medications?
Since 2 months.
Since 2 months. Okay. Tell me that do you have any history of hospitalization?
No, doctor.
Any cough right now?
No, doctor.
Any shortness of breath?
No, doctor.
Any weight loss?
Yes, doctor. Because of TB, I had weight loss.
Okay. What do you do for your living?
I work as a bank manager.
So this condition is impacting your job?
Yes, doctor. It is. I'm taking sick leave. I'm not going these days. I'm doing work from home.
I can understand that this might be very difficult for you. And tell me, is there any support or help at your house?
Yes, doctor. My son is taking care of me.
That's good. Do you smoke?
No, doctor.
Do you drink alcohol?
No, doctor.
What about your daily dietary routine? Are you taking healthy diet?
Yes, doctor. I'm trying to.
Okay, that's really good. Okay. So what are you? What thing is crossing over your mind?
Maybe it's because of any TB side effect or TB complication.
Okay, that's a valid concern. And which thing is worrying you the most?
Doctor, is the joint infected? Like, will I have to stop my medication?
Okay, I will let you know about it. And what are you expecting from me today?
I just want any strong painkillers.
Strong painkillers. Okay.
Yes.
So let's summarize, Mr. Abdul Rahman. Let's say you are saying that for the last 1 week you are having this hot and painful right knee, and you are also taking the TB medications, and after that you have noticed that, and you want me to give you some medications for that. Okay, is it
Yes,
all, or
doctor.
you want to add something?
No, doctor, that's all.
Okay, Mr. Abdul Rahman, I want to examine you. Can I do that?
Sure, doctor.
Okay, just sit here because you have pain. So is it possible for you to come to the couch, or you want me to examine here?
Doctor, can you do examine here?
Okay, sure. Could you please remove your trouser, move it up?
Okay.
Okay, in the presence of complete privacy, I will first do the general physical examination. I will check the vitals. Then I will check the patient's, inspect the patient both knees. Then I would lightly palpate the joint line, the swelling, and I will ask the patient, can you move your leg?
Yes, doctor,
Okay.
I cannot, I can hardly move it.
Okay, no, it's okay. Okay, that's it. Okay, just cover your leg. Thank you so much. Okay, so on
Okay,
the basis of your
vitals.
history, yes, vitals then.
Okay, vitals 130 by 80, a heart rate 92, temperature 37, right knee red,
Mhm.
swollen, hot, very tender, flexion severely limited. No other joint affected.
Okay. So, on the basis of history and examination, Mr. Abdurrahman, what I think is that you are having arthritis, joint arthritis, which is because of the one of the drugs you are taking of for the TB, like
Okay.
pyrazinamide. Are you getting me?
Yes, doctor.
So basically, what happens that this drug causes the gout or arthritis. Okay, and for that, what I can do is that I will give you my nurse. If you want any injection, I will give you IM diclofenac 75 milligrams. Okay, to relieve your pain and NSAIDs. Okay, and
Okay.
meanwhile, what I would like to refer you to emergency. Okay, where
Okay,
your
doctor.
joint specialist, yeah, where joint specialist will do some test. Okay, and
Okay.
your chest doctor will also review your medications, and it might be possible that he will change and stop it. Okay, for some
Okay,
time.
doctor.
Then once your
Okay.
condition will improve, he will start again. Okay, so I'm referring you right now, and I am also giving you a leaflet regarding your condition. Okay, once you are fine, you can come to me, and then we will discuss about your prevention and about the TB medications. Okay,
So, doctor,
do
why
you
not
have
you just give me medication and any gel so I can stay home? It will help me out. What do you say?
no, right now your joint very swollen. Okay, and it should be reviewed urgently. Okay, so
And
for
what they
meanwhile,
will do with it?
okay, they will do what they will do. They will examine it. They will do. It might be possible that they will change your medication. Okay, and they will change and they will do some x-ray of your leg, and it might be
Okay,
possible that they will do some test, like a water needle water test.
okay, doctor.
Okay, they will inject some needle and they will check your water inside, which is inside your joint.
Okay,
Okay,
doctor.
and they will manage your accordingly. But meanwhile, stop
All
the
right.
medication. I'm giving you some oral medications also, and I've given you the injection. I hope it will be better.
Okay.
And
Okay.
do you have any other concerns? You can ask me.
No, doctor. No, doctor. Thank you.
Okay, thank you. Thank you for your coming.
Okay. So, Dr. Sumaira, yes, this was the gouty pain, or you can gouty arthritis, knee pain on pyrazinamide, hot swollen joint. Every time patient is coming with a hot and swollen joint and it's painful, so this is directly going towards the gout. The presentation will always be the same. So when the patient is telling you like, doctor, even though I'm taking my daily medication, he said it on HOPI. So from there you will get the history. You will ask which medications you are taking on the daily basis. Okay.
Hmm.
Usually
Hmm.
we don't do it in the beginning because we are tracking down like history, HOPI, then past medical, and then drug history. But no, when the patient himself told you, like they will give you a clue after taking the medication. So I said, even though I'm taking my daily medication, so you say, which Mr. Abdurrahman, which medications you are taking? So he'll tell you my TB medications and this and that. So from there, you will cut short your history. Otherwise, your history was fine up to 6 minutes. It's quite
Hmm.
fine, but still, it can go 1 minute less. And usually,
Hmm.
um, when you're doing for the TB, you will have to ask like other red flags. You ask it later, but
Hmm.
you can ask like since it's 2 months, he
Hmm.
needs to repeat his PCR again in two
Hmm.
months of taking the medication. Okay,
Hmm.
and
Okay.
again, the other if the other medications also developing any pain, like do you have any right upper quadrant or sorry, the tummy pain, severe kind of tummy pain, changing of your skin color, or
Hmm.
any change of your urine color, or any
Hmm.
eyesight changes. Okay,
Getting a vision.
to screen for other side effects also. Otherwise, this is clear-cut side effect of the medication. And ideas. Yeah, at the end, even though he's inclined to go to the emergency, but they might resist you. So you have to tell that if we don't control it right now, even though you are already on TB medications, it will be difficult for us to handle you at home. So you need an admission to have a specialist review. They might aspire or take the fluid and confirm the diagnosis. Because even though it's a we can diagnose it on clinical basis, but it needs aspiration to be for confirmatory because it could be septic arthritis, okay? But again, septic is more than 37 or 38 temperature,
The
more than
patient has not
38,
any
and it's
fever.
quick history. Yeah,
Mm-hmm.
and otherwise, you have just to recognize like it's monoarthritis on parasyndrome, could be gout,
Mm-hmm.
and the plan is to refer and also involve the TB team, and they might stop you on this medication and then safety netting. Also, express for the PCR, the TB, um,
Yeah, PCR point I
when,
missed.
yeah, yeah, we
Hmm.
need to repeat it after 2 months.
Okay.
Okay.
So,
And
so
when
I
the
like
case of TB is coming, even though they are on medication,
Mm-hmm.
even they are on medication, we still have to ask about contacts, like with whom you are living, and do they have similar symptoms like you have. If you get the time, like you had one last minute remaining, so you can still ask in the beginning, or you can add in the safety netting, like if anyone in your family is suffering from like cough like you had, or
Mm-hmm.
then you can bring them up. And especially when the patient is telling you, I'm on treatment of TB, which TB is
Mm-hmm.
that? Okay.
Okay.
Either if this was on the lung TB, they
Extrapulmonary
might
or
have
Mhm.
extra pulmonary. So we need to know. Okay, so
Okay.
this is done.
Can,
I don't.
Dr. Musarad, can you please repeat what the management I have offline at that time that is stop the drug? Uh, p- p-
Yes.
what?
We
Okay.
won't stop the drug. We will
Oh,
refer it to the
ref
emergency because they,
emergency. Okay.
yeah, for the joint aspiration and evaluation, and also express this to the patient that this could be because of your medication, but still for the further confirmation, I am referring you to the emergency department for specialist input, and also I'm involving your TB team for changing your drug. Okay,
Okay.
and
Okay.
safety net, yeah, and you are referring it right now. And yeah, if the patient came alone, you cannot let them drive on their own.
Mm-hmm.
You would say that I am accompanying you with my staff, and they will be taking care of you, informing your family at home. Okay.
Yes. Yes.
Okay. So next, in the last case, Mr. James, 32 years old, male, came to discuss his problem with you. Please proceed
Mr.
with
James.
history examination.
Okay,
Uh,
32 years,
yes.
history management. Examination also, no?
Yes, yes. The time starts now.
Okay. Hello, good afternoon. Mr. James, my name is Dr. Sumera. Please tell me what brings you here today.
Doctor, actually, I've been feeling awful for a week now. I'm not hungry these days.
You're feeling what? Sorry?
I'm feeling awful.
Awful. Okay.
Yes,
Awful these days, and you're not feeling hungry.
yes, doctor.
Okay. Could you please tell me more about it?
Yes, doctor, it's been going on for a week now. I was feeling first tired, no energy, was feeling sick all the time, and I have this discomfort under my ribs.
Mm-hmm. Discomfort under your ribs. Okay. So, since how long you're having these symptoms?
1 week.
1 week before you were totally fine.
Yes, doctor.
Is there anything happened 1 week before, or in your change in your lifestyle, or anything which due to which these symptoms are occurring? Do you want to tell anything?
No, doctor, not specifically, but
Mm-hmm.
yeah, I'm not taking a very good diet, and I have some uh, weird habits. Like I had a tattoo done 4 months ago, and I'm taking alcohol so many on weekends.
Sure, sure. I will. Okay, I will. We will discuss about it. Please tell me that. Are you having any fever right now?
I don't know, doctor, but I feel feverish.
You feel feverish. You haven't checked your blood. Check your temperature.
No, doctor.
You said you were feeling sick. Have you vomited?
No, doctor.
Have you you noticed a change in your urine color?
Yes, doctor. Very dark urine and also pale
Mm-hmm.
stools.
Pale stools. Okay. Any abdominal discomfort?
Yes, just on the right side under my ribs.
Okay. Tell me that do you have any change and notice any weight loss?
No, doctor.
Okay. Um, any blood in blood in your vomit?
No, doctor.
Okay. Tell me do you have any long-standing illness?
Um, I just take paracetamol for my headaches. It's occasionally, otherwise no.
Occasionally for your headaches. Since how long you are taking this?
It's off and on, doctor, since so long.
Any any positive family history of long-standing disease, any gut disease?
No, no, doctor.
No. Okay. Tell me that what do you do for your living?
I work in a mall as a shopkeeper.
You work in a shopkeeper. Which shop?
Yeah,
Which kind of shop?
in a mall. It's just a fragrance shop.
In a mall. Okay. And is there any stresses in your job?
No, doctor.
Okay. Do you smoke?
No, doctor.
Do you drink alcohol?
Yes, doctor. I take few beers at weekends.
Few beer. Okay. Okay. Tell me, have you traveled recently somewhere?
No, doctor.
No. What about your dietary habits? Do you eat home food or outside?
Mostly outside food.
Outside food. Okay. And what about water? Do you take boiled water or any water?
Any doctor? I'm taking boiled water.
Boiled water. I want to ask you one private question. Can I ask?
Sure, doctor.
Um, are you sexually active?
Yes, doctor. I have new partner.
Sorry,
I have a new partner.
you have a new partner. You are unmarried.
Yes, doctor.
Do you practice safe sex? Meaning, do you use condom?
No, doctor.
Okay. Tell me, is there any do you have you done any piercing, any tattooing recently?
Yes, doctor. 4 months ago, I did this tattoo done from a small studio.
4 months ago. Okay.
Yes.
And okay. And tell me, do you any blood transfusion history?
No, doctor.
Okay. So tell me, what is which thing is worrying you the most?
I just worried that it could be some liver problem.
Mm-hmm. Okay, we will discuss about it. And which thing is crossing over your mind?
Doctor, if it's an infection of the liver, will I be giving it to my partner also?
Yeah, I will address your concern. And what are you expecting from me today, Mr. James?
Any blood test to find any cause of, or if I need any hospital admission?
Sure, sure. So this condition is impacting. You are saying you are having on leave. You are on leave, or you are going to your shop.
No, doctor, I'm going daily, not taking any leave.
Okay. So I want to examine you, Mr. James. Can I?
Sure, doctor.
So, in the presence of complete privacy and chaperone, I will do the. Could you please? I will sanitize my hands. I will ask the patient that I will do general physical examination. Okay, I will check the BMI and all the things. Then I will check the jaundice, anemia, palmar erythema, and then I will check. Mr. James, could you please lie down straight? I want to examine your tummy.
Okay, doctor.
Okay. During the examination, if you feel any pain, let me know. Okay. Just quick. Can you remove your shirt, please?
Okay, doctor.
Okay, I will start from the left lower quadrant and I will do in the S-like position. First, I will inspection, then I will do superficial palpation, then I will do the liver palpation, and I will see the how much the lower border is. Then I will palpate the spleen and I will check the kidneys. Okay, and I will check and I will do the percussion and auscultation
Okay.
and for gut sound. Okay, and I will also check the jaundice in the eyes and oral examination also. Okay, and
Okay. Vitally, patient
fetal
stable.
edema also. Yes.
Okay, okay.
Tell me examine.
Patient vitally stable and jaundice is clara, mild is
Mm.
excoriation on the skin, and
Mm-hmm.
mild right upper quadrant tenderness, liver edge palpable, no grossly enlarged, no ascites.
Okay, and excoriations also there.
Yes, because of itchiness.
Okay, because of HNS. Okay, okay. So, Mr. James. Okay, Mr. James, what you have told me and what I have examined you. So I feel that you have a condition which we call is hepatitis. Have you heard about it?
Yes, doctor, is something about liver.
Yes. Basically, it is inflammation or infection of the liver. It has different causes. Okay, but we have to investigate first. Okay, and I would like to
Okay.
do some investigations. Can I?
Okay,
Can you
doctor.
do that?
Sure, doctor.
Okay. Okay, I will do some investigations. Like I will do first full blood count. I will like to do LFTs. Okay, and serum bile acids and
Okay.
urine dipstick and anti-HAV, okay,
Hmm.
anti-HEV. Since the patient has tattooing and unsafe sexual practices, I would also like to check as hepatitis B surface antigen, hepatitis B E antigen.
Okay,
Okay,
pending.
pending. Okay, so Mr. James, what you can do is that you since you are having these symptoms, so you should if you I would like to give you some few suggestions, like try to hydrate well. I will also give you sick leave. Okay, and for about 2 weeks to your employer. Try to avoid sharing towels. Try safe sexual practices. Okay, well, hydrate yourself, take light diet, home cooked food, and whenever you come out from washing, you do like thoroughly wash your hands. Okay, before eating and after coming out from washroom. And if you feel like you are having severe tummy pain and throwing up and severity of the symptoms, you can come to the emergency or you can come to me. And I'm also giving you a leaflet regarding your condition. Okay, and meanwhile, if you have any concerns, you can come to my clinic. Time is
Okay, so
up
when
right.
should I come back, doctor?
You come back after 1 week with these reports.
All right. So, Dr. Sumera, yes, if we go from the beginning, we almost asked everything but itching and the change of color of the skin. Okay.
Mm.
You asked about the change of color of urine and pale stool, but itching of the skin, if you get time, you can ask him because it's one of the questions.
It is a
Alcohol
acute
intake.
hepatitis, Dr. Masarat.
Yes, it's viral hepatitis, acute
Okay.
hepatitis. Okay.
Okay.
So the
Okay.
patient in general, it's middle-aged patient, or you can say um, he was having risk factors of tattooing done, sexual partner, but he wasn't on any IV drugs. Did you ask for any recreational drugs? Because here it was needed to ask. Okay.
No, recreational drugs I didn't ask.
Yeah, any IV drug or any recreational
I
drugs.
asked about the IV, like transfusion, blood transfusion only.
Yeah, blood transfusion, but drugs should be asked also.
Okay. Okay.
Okay.
Okay. Sure.
And
Okay.
medications, he was using paracetamol occasionally for headaches because we can think of paracetamol as excessive paracetamol can be one
Hmm.
of the cause of liver damage, but in this case, he was taking occasionally, not regularly.
Hmm.
So past medical
What
history,
about the manage? Okay, tell me. Yes.
yeah, and I'm going one by one. In past
Okay,
medical
sure.
history, there was no any problems. Eyes, he was already expecting it. Concern was very important concern that will I pass it to my girlfriend? So it wasn't addressed.
Oh, yes.
Okay. Yeah, even though you told in the end about the safe sex habits, but here we need to tell him until your reports are done or we get your results, please have safe practices, or you can say that. If it's possible for you to avoid until we get the reports. This is one kind of viral hepatitis. Sometimes it might come as a I don't want you to involve my partner or tell them. Then in that case you still have to involve them. You can tell anonymously. Okay.
Hmm.
Yeah. So if we go from the examination and management plan, examination was quite fine, investigation was all done, but try to take shorter time in investigations. Like you're going to do right away LFT, CBC, urea electrolytes, viral serology. And you can, if you want to be specific, HAV, HBS antigen, it will be very long that, but you can say viral screen or viral serology. Okay. If you
Hmm.
say one by one,
Okay.
it will take a lot of time. In the management, you will just tell the patient if they are hemodynamically stable. Right now, he's stable. He doesn't need a
Hmm.
sick leave, honestly. But yes, he needs precaution, so he doesn't transfer it to the other people until it's HAV or HCV, it's hepatitis ABC is confirmed. He needs to be taking extra precautions. He will be
Oh, I
taking,
see. So
especially
vitally
the
stable, no need to sick leave. If vitally stable.
yeah. Yes, in this
Okay.
case, not in every case. Okay, in this
Yeah,
case, he's
yeah.
vitally stable. We just need
Okay.
a supportive treatment by now because obviously it's a viral. Until it's hepatitis C, we can treat it as supportive. Advise the patient from abstinence from alcohol, very important. Okay, tell him, is it possible for you to not take alcohol because this might be further damaging your liver as he's concerned about liver. Okay, you cannot tell them to completely cut off, tell them to if you can avoid it until you are being treated. Okay, and then you can say in a follow-up we can decide for your quitting plan or if you want to if you make your mind
Okay.
up. Okay, avoid unnecessary drugs if the like patient is taking too much paracetamol or any herbal
Hmm.
remedies. Mostly people will come like I'm taking herbal remedies, so tell them to avoid it completely. Refer the patient
Hmm.
for the hepatologist or hepatitis clinic when the reports are in your hand, like especially hepatitis C positive. Counsel for the transmission risk, as you told about the partner, tell him it strongly not to give any blood. And
Hmm.
sometimes if the patient is telling you that I have developed this condition and I already donated blood like before this, so still we have to involve the public health authority to screen the patient they already donated blood. Yeah, HIV can be done also, Dr. Farin. And also tell him that no sharing of razors and needles. Okay.
Hmm. Okay.
Notify when there is any, but in this case, you have to notify the public health authority. Yes, bring the partner also if he's okay with that. Otherwise, trace the contacts anonymously because this is his new partner. He could have already given it to the old partner. So we are involving public health authority. They will be doing it. Okay. And safety
A public
netting,
health
as you told,
authority for what? Public health authority for what? What?
for contact screening anonymously.
Like for
Okay, first you
sexual
will ask the
contact.
patient. Yes, yes, yes. You will ask the patient to bring your partner. If he denies, then you can still involve the authority. Okay, for
Acha,
contact
okay.
screening. Okay, and if he gets any drowsy or heavy, severe kind of pain, or worsening of the condition, that he should present to emergency department as soon as possible, and try to tell him to be supportive treatment, like try to take more fluids, good diet, healthy diet, try to cut off the junk food from outside. Okay, and good hygiene, as you already told. Okay, so this was the whole case.
Is there any major mistake in my case?
Not apparently, but only one thing about the transmission. You already told, but partner and contact screening should be done. Very important.
Okay. Since
Okay.
the case is very
Otherwise,
open to all the, like since this case is very, like open to all the hepatitis and the reports were not there. So we
yeah,
have to, counsel about all the, in journal, no?
yeah, touch the
Okay.
almost at each and every point. Because in an OSCE exam, mostly this time, what we saw that they weren't giving the lab reports. They were staying quiet.
Okay.
So they just want to
Okay.
see that, and you won't bring the patient after 1 week. Tell him as soon as you get the reports, even though it's in 2 weeks, then they should visit you. Okay?
Follow up in one week, na? Okay.
No, 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 no. Follow up as soon as you get the reports done. Okay?
Dr.
अच्छा, अच्छा,
Musarraf,
ठीक है.
Yes.
one question I just want to ask. So, should we advise that they do safe sex, or should we tell that avoid sex till the reports came, and bring your partner also? So we will check
Both
her status also.
both is fine because we are being
Safe
safe
sex
doctor.
practices should be done, na? हाँ.
Yeah. Firstly, we will tell if it's possible for you to avoid until your reports are there, because it might transfer it to your partner as you are already concerned. And secondly, can you bring her so we can do her lab results also? Okay. So this
Lab
is for
results of
all.
partner. Okay, which lab results for partner?
The same viral screening.
अच्छा, अच्छा.
Okay.
Actually, the
So
thing is
that's all
that
for
Should we
the
today.
ask
only
about
candidate
vaccination status
who
also?
have
Yeah, importantly, vaccination status should be asked, but in this case, it wasn't asked.
vaccination
Okay.
status. Okay.
Hmm.
You know, in 10 minutes, there is so much to do. Like, I don't know how it will happen in exam. So
Dr.
much.
Somera, one important thing I'll tell you. I felt in when you were doing the case, you were getting in speedy mode to finish everything. No, that's not what's needed. Actually, yes, we have
Uh,
to at least touch each and every point, but how you do it,
mm,
you don't have to explain everything, and they don't see that you tick mark everything. They will see what your approach was, because they know that in 10 minutes you're never going to deal this kind of patient. You have to be very detailed in these cases. It takes almost 15
mm,
to 20 minutes if you are in general setting. So they know that you are touching every point, you have the knowledge, your approach is fine. First, it should be patient-centered, and the management plan, uh, just to be a safe doctor. Okay? They won't
mm,
see that Dr. Sumera didn't ask this, so let's do the negative marking now. They see the
mm,
holistic approach. Even when the students are giving, candidates are giving their feedback, and they tell that in in cholecystitis case, the patient, the SP wasn't telling us the things. They won't tell the cholecystitis case. Okay, they will never reveal their diagnosis, because there is never one diagnosis. Okay. They are saying that we are
mm,
seeing your holistic approach, how you take the patient all along, not just you are making the
mm.
right diagnosis, asking for the right investigation, right management plan. In fact, are you involving the patient? Are you being patient-centered? Is patient comfortable with you? Okay, it's with
Yes.
confidentiality, your consultation skill, everything is included. Okay,
Yes.
so that's all
Thank
for
you.
today. Best of luck
Dr.
for
Musarraf,
tomorrow's exam, people.
s-
Yeah.
sorry, I just want to ask you one thing. If we go in a speed, like asking questions in a speed, does it negatively impact? Does it have some negative impact?
Yes, a kind of like they will say that you're not actively listening to the patient, because there we have to listen the patient, have a eye contact, let them finish, and ask accordingly.
Mm-hmm.
So it's kind of critical skill, but it will develop side by side, because sometimes you miss a little bit small thing. It's okay as long as you
Mm-hmm.
are actively listening to the patient. And sometimes it happens like has already
Mm-hmm.
told you, I don't have fever with this and this, and again you ask it because you have to tick mark your list. So that's the negative impact.
Mm-hmm.
So
Okay.
I try to just ask two red flags and two differentials. That's it. Because mostly you will get the diagnosis in opening sentence.
Because this came in my mind because sometimes we go in like to complete our history and all the things, examination and management. So we ask in a rush, like in a speed. So we
Yeah.
have to show like some gestures, body language,
Yes.
nodding and listening to. So this, I think, this should be.
Yes, yes, you have to be very like professional in this case, not just tick listing, but also
Mhm.
showing empathy and all that. That has marks also. Even in the sitting posture you are having with the patient has marks. Okay,
Mhm. Okay, thank you so
so that's
much.
all for today. Don't worry about it. It will develop like in time. It will, these skills will develop in time. Okay,
Thank you.
Yeah,
take care, everyone.
inshallah.
Everyone.